Anil's there. Because I needed to read his kind of brief bio.
Place is down. Put your phone on top of it. So you're gonna leave that.
Yeah. So I can just scroll through my phone, isn't it? Yeah. Okay. All right. Okay.
You could turn it.
Okay. Okay. Good afternoon, everyone. Good afternoon. Yes. My welcome. My names are Henry Mwambi from the University of KwaZulu-Natal, School of Mathematics, Statistics, and Computer Science, based in the Pietermaritzburg campus. And it is a pleasure to welcome you all to this session this afternoon, which is actually a symposium organized by the DSI-Africa UKZN hub on research training on harnessing data science for global health priorities in Africa, which is a training program. And we have given ourselves a name called Washa Takwimu, which in Swahili means ignite data, basically expanded to mean working on application for data science and health in Africa. So this afternoon, we are having a symposium, which is a hybrid mode symposium on mentoring. And the opening remarks were initially supposed to have been given by Professor, they were supposed to have been given by Professor Busi Nkama, who is actually the Deputy Vice Chancellor in the College of Health Sciences, but she couldn't come because unfortunately she lost her mom and she couldn't come. So we actually sent our condolences and our sympathies to her. However, the opening remarks now will be given by Professor Anil Chuturgan. It will be given by Professor Anil Chuturgan, who is actually let me just briefly tell you who Professor Anil Chuturgan is. Professor Anil Chuturgan is actually a medical biochemist and has a PhD in toxicology and epigenetics. He is a professor and head of medical biochemistry and is currently the Dean of Research in the College of Health Sciences here in UKZN. He is a B-rated medical scientist by the National Research Foundation of South Africa, has published over 200 research papers, 12 chapters in books, edited 2 books and many conference proceedings. He has an H index of 34. He is actively researching epigenetic phenomena in toxicology and its implication in human diseases. He is an expert on mycotoxins and their biological toxicity in humans. He pioneered research on fusareotoxins and epigenetics and their implication in diseases. His contribution in toxicology has been recognized by CTD curator, supported by the National Institute of Environmental Health Sciences, USA, where 8 of his manuscripts are included in the database. This database provides manually curated information about chemical gene protein interactions, chemical disease and gene disease relationships. He has successfully supervised and graduated over 150 masters and 50 PhD students. He serves as editor on several journals, is member of the South African Society of Biochemistry and Molecular Biology, and executive member of South African Society of Clinical Biochemistry. He is an avid mountain biker as his hobby. So that was quite, what can I say, heavy. And we are happy to have Professor Anil Chiturgan to be with us today. But before he comes, I want to say that this program you are actually attending today is a collaboration between Harvard School of Public Health, represented by Professor Fauzi Wafai, who is here with us, the Heidelberg Institute of Global Health in Germany, represented by Professor Till Bergenhausen, who is also here with us, UKZN, represented by myself and Professor Mosa Moshabela, who was our DVC research. But now, as you know, he's going to move to UCT as the VC. And then you've got also 4 Sub-Saharan Africa partner institutions, Ibadan University in Ghana, University of Ghana, Ibadan University in Nigeria, University of Ghana in Ghana, Muhimbili University in Tanzania, and Makerere University in Uganda. So we are very pleased to have this assembly today. And Professor Anil Chiturgan, please welcome. Let's clap for him as he comes to give his name. Thank you very much.
Firstly, I greet you from the College of Health Sciences at the University of KwaZulu-Natal. And I welcome you to this very sunny city where we only have 3 seasons in the year. It's no winter at all. So this is the midst of our winter. And you can see that we have wonderful weather here. So welcome to all our delegates from out of Durban to this most beautiful city. Secondly, I convey the apologies of my DVC, Professor Ngama. She had a tragedy in her family, as Professor Henry has mentioned. Her mom passed away yesterday. So I'm going to do the welcome address on her behalf. To our esteemed colleagues, very distinguished guests and participants, welcome to Durban. And as I said, also the Vice Chancellor, Professor Nana Poko, extends his greetings to you. So on behalf of Washa Takwimu, which is the working on applications for data science and health in Africa, I'm delighted to welcome you to the annual symposium of this training hub at the University of KwaZulu-Natal. It is indeed an honor to have you all here, both in person and virtually, for what promises to be a very stimulating and enriching event. Today, we gather under the overarching theme of mentorship. Mentorship is the cornerstone of growth and development in any field, but particularly in the health sciences, and now in the realm of health data science. It is through mentorship that we can share knowledge and skills, foster innovation, and build a robust community of researchers dedicated to advancing health outcomes in Africa. We are especially privileged to have with us today our keynote speaker, Dr. Mayet Razak, who joins us from Vietnam. Dr. Razak's expertise in mentorship and development of early career academics is very highly regarded internationally. Dr. Razak, your insights and experiences will undoubtedly enrich our session and inspire all of us to cultivate strong, supportive, and effective mentorship and relationships within our respective institutions and beyond. The research training on harnessing data science for global health priorities in Africa, under which this symposium is conducted, is a testament to the power of collaboration. With UKZN as the hub and our esteemed partners in sub-Saharan Africa, namely the University of Ibadan in Nigeria, Makerere University in Uganda, Muhimbili University of Health and Allied Sciences in Tanzania, and the University of Ghana, we are building a formidable network of health data science research capacity across the African continent. This initiative is led by 4 distinguished principal investigators, namely Professor Wasai Fauzi from the Harvard School of Public Health, Professor Moshe Bela from UKZN, and now recently joining some nondescript university in the Cape. Professor Henry Mwambi from our university, and of course, Professor Till Bergenhausen from the Heidelberg Institute of Global Health. Our training program directors, Professor Saloshni Naidu from UKZN and Heather Marty from Harvard University, have worked tirelessly to ensure the success of this program. We are also deeply grateful for the support of the National Institutes of Health and the Fogarty International Center, who have made this program possible. As we embark on today's discussions, let us remember the immense potential we hold as a collective. By harnessing the data science for global health priorities, we can address some of the most pressing health challenges facing the African continent. Let us use this symposium as a platform to share ideas, forge new collaborations, and strengthen our commitment to improving health outcomes through data science. Once again, welcome to the DSI-Africa Washa Takwimu Annual Symposium. I look forward to a day of insightful presentations, meaningful discussions, and the forging of new partnerships. Thank you very much.
So now it gives me pleasure to welcome Professor Fauzi, who is one of the PIs of the DSI-Africa UKZN Hub project. And he's here with us. He's going to give some review about our data science program in Africa. Welcome, Professor Fauzi. Thank you. Let us
Great. Thank you so much, Professor Henry Mwambi. Good afternoon, everybody. A pleasure to be back in Durban. Thank you, Professor Anil, for the welcoming remarks for all of us. Delighted to be back in Durban. The weather is not only perfect, but it's always nice to be in this sort of community where there is a lot of friendship and intellectual rigor and massive sort of engagement around elements of common interest. So thank you for having us back. This week we have been with the rest of the partners working on a course in this same room around food systems, climate change, and planetary health. And I see in the audience many of the trainees. multiple disciplines and engagements. So I'll say a few words about the program and where we are so far, and be delighted then to introduce our keynote speaker shortly. No worries. So it has already been mentioned that our program is around data science. One of the sort of hallmarks of the program really is an effort to recognize that there are many global challenges that we face together. So multiple challenges. Could I have that? Multiple challenges, and increasingly, the list keeps growing. We have been dealing with a lot of issues around maternal and child health, undernutrition, the rising tide of non-communicable diseases, cancer, mental health, and so on. At the same time, we are fortunate and blessed really to have extensive data sources that allow us to look at many of these issues. But we haven't been sort of tapping into these data as much as we would like. We would have an opportunity really to examine these data and come up with novel insights and interventions that enable us to compare lessons across settings. The main challenge is that there is really a shortage of scientists who are capable to interrogate that data. The data are massive, multiple sources. We have data that are collected routinely, national data sets from DHS, from demographic surveillance systems in all countries. We have data that come from health facilities, data that come from wearables that are increasingly available with downloadable data, data from satellites, and so on. And the challenge really is to bring these data together, harmonize it in a particular way, and enable it to be available to examine particular questions. So that's where Washa Takwimu, our training program, is poised to contribute to address this shortage of data scientists, to enhance training of those individuals, and really to do that around questions that are of relevance to the settings where we are working in Africa, to really bring together research and training hand in hand and enhance the capacity of African scientists to examine these questions. Our program is part of an NIH program. It's a consortium funded by the Common Fund of the National Institutes of Health in the United States. Essentially, it has these goals that are noted on the slide. It's the data science for health discovery and innovation in Africa, known for short as DSI-Africa, that brings together various institutes at the NIH and advances issues around research and training with a focus on the African continent. It addresses research, training, as well as ethical, legal considerations that come with the availability and use of data. Our focus is particularly on training. It's a consortium of grantees. Some do research, some do training. We are one of 7 programs. Ours is Washa Takwimu that seek to build that capacity in data science. And between the 7 countries, it covers quite a range of the African continent. And these are the countries that are active in this program. Has already been mentioned, Washa Takwimu is Ignite Data in Swahili, with a focus on 3 elements really. One is strengthening training in methods. And the second and third are applications of those methods to two aspects of global health priorities. One around health system strengthening, and the other around food systems, climate change, and planetary health. A brief has already been mentioned, so it is a hub and spoke model. The hub is at UKZN, led by Professor Musa Moshabela and Henry Mwambi. Delighted and happy for Professor Moshabela to move to UCT. We will continue to engage with him, but there is a deep bench of scientists and leaders at UKZN that we continue to advance this initiative, including Saloshni Naidu and other colleagues at UKZN. That's the hub. We are delighted to have the 4 spokes that were mentioned, Ibadan, Makerere, University of Ghana, and Muhimbili. And fortunate, really, between Harvard and Heidelberg as 2 northern institutions to be partners in this initiative with our African colleagues and leaders. These are the faces that you would recognize: Henry, Musa, Till Barninghausen, Saloshni, and Heather Matty, who is one of our training directors at Harvard. Our spoke leaders, delighted that 3 of them are here. And you will get to interact with them. Professor David Gwatude, Dr. Candida Moshiru, and Professor Angela Chuku, Nigeria, Tanzania, Uganda, and Professor Chris Gure from University of Ghana was unable to join us. And partners at larger sort of UKZN campus, Professor Onisimo Mutanga, Professor John Odindi. Delighted that Sandra Bertit from Heidelberg is also here with us, and Professor Marcello Pagano at Harvard. We have a technical advisory group that guides us. Some of the names you might recognize. These are leaders in various aspects of data science, methods, as well as the domains that we are focusing on. And we are fortunate to engage with them and benefit from their insights. Briefly, really, a big picture around what the program is and an opportunity to sort of present a status report on how far we are to all of you. These are our aims, essentially 3 main aims: to train mid-level and senior level researchers, to build the capacity of junior public health and medical professionals across sub-Saharan Africa, and ultimately to develop a master's degree at UKZN in health data science that harnesses these sort of opportunities that are built over time to culminate in the development of a master's that provides sustainability of the program. These are the deliverables that we have been focusing on, or the activities, and I'll mention just a word about each one of them. The effort really is to bring these various elements towards, as I said, an ultimate goal at the end of 5 years, and we are in year 3, almost midway through the program, to establish and launch this master's here at UKZN. The first element is around faculty training. We are delighted to have 4 colleagues who are going to be traveling to Boston to engage with faculty on the other side around advancing their professional interests in data science, as well as their sort of vision for how the health data science program here at UKZN could benefit from learnings from other settings. We had a meeting with the 4 of them this morning: Professor Chifurira, Dr. Habiramana, Dr. Desi, and Dr. Jessica. First name is easier for me, Jessica, I'm sorry. And all 4 have really wonderful ideas already and goals and objectives for their time in Boston. We will have 2 of them traveling this fall in a couple of weeks, and the other 2 will be traveling next spring. And then second deliverable and activity that we have been advancing over the past 3 years and through the remaining period is building a cadre of postdoctoral fellows. Our target has been to recruit 5 postdocs, help them grow professionally, go deeper in methods, and go deeper in application of those methods. We have a first cohort of 4 people who have been quite successful, I would say. 2 of them are sitting here, Dr. Gabriel and Dr. Muhannad, quite productive. And Dr. Ashinafi and Dr. Haile enabled really them and their engagements through the program to learn, to publish, to develop new ideas, and hopefully on their way to be independent researchers and leaders in this field. We then have a second cohort of 3 postdocs, so a total of 7 so far, and we are already midway through the program, and we have exceeded our target of 5 because we have a total of 7 so far who have just started earlier this year in January. Dr. Mugisha, a postdoc from Uganda, Dr. Tlu from UKZN, and Dr. Jovin from Tanzania. All 3 are going through the beginning of their fellowship. Now they're a few months old. It's a 2-year fellowship program where they spend some of the time in Boston, some of the time at Heidelberg, and a good amount of time here at UKZN interacting and benefiting from the faculty who are here in various schools. Another target for us is to enhance our reach to a larger number of people through short courses. And there are, as I said, methods and 2 domains, and the short courses really follow that. So these are the short courses in data science methods led by Professor Mwambi and many colleagues who have contributed to the planning and delivery of the courses, faculty at Harvard, faculty at UKZN, around these various elements of data science methods. A total of 9 courses have been delivered so far, and hopefully more into the next couple of years. And then there are courses in the domain areas, courses in climate change, food systems, and planetary health, and courses in health systems to enable trainees to tap into their understanding of methods and apply those into these particular research questions. This is the course that's ongoing this week and has been really an amazing opportunity to engage with faculty and with trainees so far. So we have 4 faculty, we have 7 postdocs so far. We have many more who attend short courses, and we aspire really through monthly seminar series to reach a larger number of individuals, to create a bigger community of scientists across the continent, not only in the hub and spokes with some engagement from the northern institutions, but throughout the world, where our people who are interested in data science methods come together around seminars where they are presenting or they are sort of attendees and have an opportunity to exchange experiences and learn from one another. These are seminars that are in the on the third Wednesday of every month. We're always happy to add you to the mailing list if you have if you are not already on that, and send you announcements so that we have you as a presenter, or we would love to have your engagement to attend and share your perspectives as other leaders make presentations. And then we have annual symposia around particular themes. We're delighted that this year's symposium is around the theme of mentoring and advancing mentoring, which we will transition to shortly. As I said, ultimately, all the training that happens, faculty training, postdocs, short courses, has elements of material and competencies that we are putting together and advancing and refining over time with one purpose, really. Obviously, the training by itself is useful for those who have taken it, but really all aiming towards a sustainable program that allows us to continue that capacity for a much longer period. And we do that in partnership with UKZN that will launch a master's program, hopefully in 2026. Professor Saloshni Naidu is taking the lead in partnership with Professor Henry Mwambi and many faculty here to bring together that sort of sustainable master's program that enables a much larger number of people to be reached over time, tapping into these faculty and postdocs as leaders themselves. So we focus a lot on training in this program, and training individuals is critical. It's a cornerstone, building their capacity, their own ability to do research. And today we will spend a little bit of time on mentorship. That's an aspect that we are keen on as a group. Lots to learn from one another. We have tried to do some in the past, but increasingly keen to do more. And today we will have an opportunity to do some of that. And then there are elements around partnerships and innovation that we are also keen on building as we advance in this program. On mentorship, as I said, it's something that we have particularly developed an interest in because it is foundational. It enables us to sort of learn from one another. It's not something that is natural for many of us faculty. So we have convened a group in 2022 in Cape Town with partners from across the continent, including our own Washa Takwimo, essentially to develop sort of an understanding among ourselves about what are sort of mentoring approaches that we can learn from one another. What are the mentoring competencies that we can teach our junior faculty and some faculty who have not been exposed to that? What are the tools that might be available from team mentoring to peer mentoring, and what are the challenges and solutions to those challenges that we can advance? So it is an opportunity for us to learn from one another. From that workshop, we are putting together those sort of gems of ideas into a paper that we hope will be more widely disseminated and provides some basis for the work going forward. But beyond training individuals and enhancing the capacity of independent researchers and faculty, we are keen on institutional strengthening beyond the individual into the institution, the whole department and the whole university. And so some of the issues really is around sort of where are the opportunities to build those partnerships and how to advance innovation and sustainability. Our Washa Takwimo has 5 institutions in Sub-Saharan Africa, the hub at UKZN and the 4 institutions, but it is part of a larger network that we are part of, all of us, the ARISE network. Essentially, it is in 10 countries in Sub-Saharan Africa. It's 9 on the map, but with the addition of Senegal more recently, there are 22 institutions from 10 African countries that are part of this ARISE network. 5 of them are in Washa, but many of the lessons and opportunities that we develop together will be hopefully available for a much larger audience through the Arise network. The Arise network is 10 years old. We celebrated the 10th anniversary last month. Many of us were convening in Addis Ababa. Started in 2014 and over time has met many times in Dar es Salaam, in Johannesburg, in Bahir Dar, in other settings, and constantly aspiring to learn from one another and do better as we seek to strengthen our own capacity as individual institutions, but also learning from one another. We focus a lot in Arise on capacity building. Washa Takwimu is one aspect, but we are keen really to bring that into research as well. So it's really research training. It's training with the purpose of using that and applying it to research methods, leading to solutions that are relevant to the communities where our trainees come from. Perhaps one last point to note that the Arise network is trying to advance the issue around partnership across countries, which is something we can learn a lot from, the 10 countries and beyond the 10 to many others in the globe, but also partnerships within a country. One of the aspirations we have is many of us are here in the university, the educational system, and we deliver master's and doctoral programs. But we are part of a larger ecosystem in the country where we come from or where we are. There are research systems in South Africa. There is ARI, there is CAPRISA, there are others. And there are health systems, the Ministry of Health or the National CDC in the country where we are. And the goal really is to not work in isolation as universities, as ivory towers, but be building capacity and asking questions that are policy relevant to our communities. And we can only do that by bringing this sort of ecosystem together in ways that are win-win. Universities definitely graduate the future leaders that go into research or go into the health system. But these colleagues in those systems are also useful and keen and happy to engage with universities in ways that leverages their strengths as internships for our students or as reflections on our curriculum and how better can we do in our own teaching in ways that are useful ultimately to have an impact. An ecosystem that is sort of grounded around country ownership that addresses priorities of that country where we are. And that's where we are aspiring to do even more. Washa Takwimu is an aspect of that, but it is part of a larger enterprise that we can only do together. With that, I would just like to end my brief comments with an acknowledgement to many people who are on the screen. I have noted the PIs, our training directors, coordinators, partners, certainly many staff and partners in other institutions and advisory committee, many mentors that engage with our short course trainees, with our postdocs, the broader consortium of data science Africa beyond Washa Takwimu, and very grateful to our funder, the NIH, the Fogarty International Center, and Laura Povlich, who is our program officer, a wonderful partner in helping us achieve these objectives. Thank you so much. With that, I will end my remarks here, and I am delighted to transition to introduce our keynote speaker for today. Wonderful to have the opportunity to have with us Dr. Miat Tu Razak, a leader in this field, as Professor Anil has mentioned already, a partner in many initiatives, He has served as a leader in global health initiatives around HIV/AIDS, research and interventions, around elements of health system strengthening in many parts of the world, in Africa, in Asia, in Latin America, and in the US. He's been active in this field for more than 30 years. Dr. Razak is a physician epidemiologist. He has contributed significantly to various NIH and other initiatives. To mention a few, the PEPFAR NIH Medical Education Partnerships Initiative, the MEPI, some of you would be familiar with that. Various Fogarty International Center programs, engagements with CDC field epidemiology programs, with WHO, and with multiple organizations around the world active in these global health priorities. Currently, Dr. Razak serves as Senior Global Health Security Advisor at USAID in Vietnam, providing strategic guidance in all facets of global health security to the USAID mission. He's taking a leadership role in development of programs to address new challenges in global health, such as climate change, emerging infectious diseases, and coordinating with diverse implementing partners and stakeholders. Prior to joining AID in 2022, Dr. Razak has served in technical and managerial leadership roles at Johns Hopkins University, FHI, WHO, CDC, the Office of the Global AIDS Coordinator in the US, among others. Dr. Razak is a physician, completed his medical training from the Institute of Medicine in Rangoon, and did MPH and a PhD in epidemiology from UCLA in the United States. He was inducted into the UCLA School of Public Health Alumni Hall of Fame in 2018 as a Lester Breslow Lifetime Achievement Award. Very honored to have you with us, Dr. Razak, and the floor is yours. Thank you so much.
Thank you very much, Dr. Wafid Fauzi and Dr. Mwanda and everyone and all the protocols observed. And then so I'm very honored to be invited to address the symposium. And UKZN is always kind of a home for me. And then whenever I have a chance to come up with the MEPI and many other programs. So good to see all of you in the symposium. And so what I'm going to be focusing today is mentoring in data science and global health in the African context. And I would like to just use that opportunity to make sure that my professional and personal development is through many mentors. Without mentors, I cannot move forward. And so I'd like to just address this and also kind of honor my mentors. And then I would like to make sure that we share our experience with the next generation of leaders. Next slide, please. This is a disclaimer. I am making this presentation in my own personal capacity. Everything I present is my personal view and opinion, and is neither of US government nor any organizations I have worked with. Next slide, please. So in this talk, I will focus more on the art of mentorship and less on scientific analysis. And from the perspectives of a student who had great mentors, a mentee who sometimes did not listen, an employee who wishes for good mentorship, and as a mentor who faced a lot of mentees like me, and also as a supporter of strengthening health workforce capacity. So I am going to focus more on application. How do we really make sure that the mentorship is used in the real world? So the inner outline is I'll touch mentoring, data science, global health, and African context from the examples and perspectives from my personal experience. So I'm just going to weave it through it. And then so just kind of like indulge me for that kind of weaving through it, because I would like to share my experience. And so from a developing country and going into I'm a migrant global health worker. I have been wandering around in many countries, many places. I'm still searching for what, I think is more important for in life. And then so this is where I'm going to go. But focus is on mentorship and application. Next, please. So what is mentorship? And I think we have already talked about it, what mentorship is from the distinguished speakers. It is a professional relationship by which the mentor, a more experienced senior faculty, guides a more junior colleague, the mentee, in developing and reassessing his or her ideas, learning and development, and substantially furthers his or her personal and professional growth. This is the definition, one of the definitions of mentorship. And it is important that mentor guides the mentee. Next slide, please. Next point. So mentorship is also recognized as a deeply rooted tradition in academics and proven path to develop of future generations of scientists. However, it is sometimes not appreciated very much. I'll go through this process and again my experience in later slides. Next slide, please. So why mentorship? Why do we have to focus on mentorship? It provides support and guidance of skills, social development, and reflection that contributes to the transformative growth of an individual's global health practice, research, and professionalism. And so this is a process of support and guidance. And then so throughout the process, and there are a lot of areas that we need to focus on, which I will just give more points later. Next point, please. Successful mentorship can strengthen not only an individual mentee, but their networks and affiliated institutions and build long-term collaborations. Like Wafi mentioned, how do we make sure that capacity building, mentorship, and collaboration, and how do we really move forward? And that is really critical. And successful mentorship can really strengthen individuals and institutions. Next slide, please. So mentoring is also essential, especially for me, in strengthening capacity, creativity, efficiency, and resilience of everyone in health force. Next point, please. However, it requires techniques, analyses, compassion, commitment, patience, honesty, trust, collaboration, and resources. Mentoring is not easy. Good mentoring requires a lot of qualities that I just mentioned. Next slide, please. So we talk about mentors. And what are the difference between mentors and teachers? Next point, please. Mentors serve as a long-term advisor who guides their mentees through life. They have a broader focus, emphasizing holistic growth and life skills. It is not just, talking about teaching. So I'll touch about it later. A mentor can help with many things, including job skills, academic pursuits, and personal development. A mentor provide life lessons from experience and guide you on how to use these lessons in your own life. This is one of the definitions that I like, and that's why I'm putting it. And so the mentors are the ones who share their guidance and lessons from their own experience. And then so that way, mentees can improve in their path. Next point, please. Teachers. A lot of us are teachers. We provide instructions and guidance in a limited setting, in a classroom or online. We focus on academic progress, building a strong educational foundation and honing specific skills. And some of our teachers are role models. Next slide, please. So now, I would like to make sure that mentors are different from supervisors. We have a lot of supervisors who are not mentors. I have employers who are not my mentors. I have coaches. I am a resilient leadership coach myself, but coaches are not mentors. Coaches provide you to go to the segment. So these are the areas that we need to be very clear of where we are going. So I'm not going into details of these, the points, because all of you have a wonderful kind of programs and teachers. And so we can go through this. You can go through the process. However, I'm just going to provide my perspectives from my life lessons, as well as the right now as a person who is providing support to institutions, and including academic institutions. And what we would like to see is, when we are looking and recruiting for employees, we would like these employees to be ready. And also having somebody that they can count on and rely on, so that way they can be productive employees and staff and the team members. Next slide, please. So we're talking about academia right now. So mentors in very different settings. We have academia, we have private sector, and private sectors are profit and non-profit. And so some of your students from data science or health sciences, they may go to private sector. And then some of them may be for profit, some of them may be not for profit. How do we keep mentoring? And how can we, as from the academic institution, keep walking through this? So this is one point that I'm going to make at the very end. And also private in the public sector, government, national, provincial, local, international organizations, and non-profit, private, public sectors, and they're independent people, who are not in any of the sectors, and some of them are in betweens. And so when we are looking through this, the mentoring doesn't stop in one segment. We have to look into different settings. And also some people move from one place to another. And some of my mentors in academia still are mentoring me. And then so, although I have gone through different process. And so this is where I would like to make sure that different setting of mentorship is crucial, and we have to be paying attention to, because not everyone came out of academia will go back to academia. Majority of them work in the different sectors, you know that. And so, but we will like to make sure that we have connections and mentoring, and that's very helpful to me. Next slide, please. And also it's compatibility of mentors and mentees. When we're looking at it, not everyone can be mentors. Not every pair of mentor and mentee works. So we have to look into the principles and values. And I'm sure again, if the Wafai mentioned about them, 9 core, the qualities, and then core values issues, and that's maybe part of it. And then, but I would like to just go through what I have in my mind. Next, please. Next one, please. Goal and vision. If somebody is asking me to be a mentor, mentor, and that person's goal is to make $10 million in his or her life, and I don't have the same goal, I don't have the same vision. These are the issues that we will need to take a look into the mentor and mentee, and what are the goals and vision? Are they compatible? Next one, please. Background experience. Sometimes mentors' life experience is important for mentee. When I look at it, and I look at my mentors who are very different from me, and I have to pick some of the parts that I value from them and they value from me, but I had a very different background. But some of them are very similar. And so these are the areas that we need to pay attention about compatibility of mentor and mentees. Next one, please. Social demographics. It is very important for us. Gender, age, race, ethnicity, orientation, and status. Some people, some mentors prefer to work with the people that came from their own status, of own background. And then so it is really difficult to take a look into where we are compatible to each other. Next one, please. But nothing is static. A lot of issues change with time, situation, and perspective. And I will share with you when I'm going through my start slides. Next, please. And I'll start with life in Burma. I was in clinical services. I love clinical work. I wasn't, and I was going to be kind of like, my goal is set. I was going to be in the surgery. But when I was looking through my training, and then meningitis outbreak among infants, and we know what to do with this. We are very well trained. And however, there's no medicine. And the people cannot afford medicine. And some people cannot even come to the hospital. And I started to look at it. What is the point of knowing everything when we cannot really help the people who need? And sometimes, we see many times, we see women with septic shock because of the kind of like abortion, kind of like in the, in the kind of local areas. And they went through so many challenges, and we are very well trained and kind of like OBGYN and others. But when they come in and with septic shock, and what we start to see is like, why? What are the reasons and how we can really help? And so I started to look into way beyond the clinical services, and also what time the osteogenic sarcoma midterm, and then my professor of surgery, and I went in, and then I asked him, why are we just doing the kind of like amputating this one? And we don't have kind of chemo and others. And so here's one of his kind of like comment to me was, what is the main symptom? Pain. So this person is going to be passing away because it was a long time ago. And then so the mentors really taught, went through not just clinical surgery, about social behavior, and then kind of all economics issues, and then prognosis. And that's when I started to realize that it is just my teachers are not teaching me in clinical services. They are really preparing me for my life. And some of them are my true mentors. And now, in '88, we had political protests and military suppression. There's a lot of killing. These are my friends, and again, I went together, and then unfortunately, that young lady passed away. And then so we started to see that although we can be really doing very well in clinical part, but people are getting killed, and the country is in trouble, what do we do? And then so I got a few more mentors, which I will talk a little bit more later. Next one, please. So, I became a co-organizer and practicing doctor of free network of clinic. And then I realized that I cannot just keep doing as a clinician. I have to just go through I would like to just understand how to strengthen health system. And also I would like to gain knowledge and skills to do so. And next one, please. And I got opportunity early because I was encouraged to leave the country because of my involvement. So I had to go. Next one, please. These are some of my mentors. These are great mentors, and from basic science to kind of preclinical to clinical, and without them I would not be where I am. And these are really wonderful people. I will just kind of like just want to recognize them. Next one, please. And so I was lucky. I was able to go to Los Angeles, and my focus was to strengthen health systems in Burma. And so I went there for MPH and health service organization, not research. I went through a lot of training, and then I got wonderful mentors. Next slide, please. Oh, I was quite stubborn, and I did not want to get any scholarship because I want to go back home and I don't want to get any string attached. And I did not understand about the scholarships, and I refused. And then I work as a part-time factory worker to earn, bus fares and food because I cannot live near the UCLA campus. Next one, please. And these are my mentors at UCLA who really helped me understand about if you want to make a difference, there are certain things that you need to do. And for example, studying more and working as a factory worker and the kind of like weekends, you're taking your time away. And we can give you scholarship, just take it. And then so for me as a kind of like a person, understanding these issues are very critical. And then they are so patient and wonderful, and they support me a lot of areas. And so I will always kind of think about it. Next one, please. And also kind of like, this is a time that in early 1990s, in fact, 1990 and 89, 90. So we did not even have an AZD available to the people. And then there's a food delivery for homebound AIDS patient. I've been a homebound person to AIDS in West Hollywood. I volunteer for it. And then I started to understand more about how even in the developed country like US and discriminations and access to care and then need for clinical advances, I started to understand more and more, because that's why I started paying attention to research as well as social services in the US. Next one, please. And I was still trying to go back to Burma, but there's a crushing blow. It's like a lot of my friends in jail asked me to stay on because I cannot. When I come back, I'll be in jail. And however, and please do something that they cannot do. So I have to keep studying. It was really that day was absolutely sad. Next. But my mentors, friends and family, unwavering support, giving me guidance, giving me thoughts, how we can change, how I can keep my principles, but find a way to move forward. That is so important. Next, please. And then so, I had to decide to stay in the US for more training and experience. And then so that really helped me going into data science and more of global health. Next one, please. So I got kind of like a job, and while I was here trying to make ends meet, and after my master's, I work at the Medically Indigent Californian Research Project, and ACGD 076, that pediatric HIV/AIDS project, and which I understand that why research is so important, that never paying that time, and then prevention of mother to child transmission. That's when I realized that I cannot just keep thinking about changing health systems without understanding the very details of research and advances. And to do that, I need to pay really attention on the kind of like rules of data in strategy development and decision making. Next one, please. So after my master's, and then I decided, I was offered a job, kind of a scholarship to do a PhD. Next one, please. So I got support from NIH Fogarty through UCLA, and as I did my PhD at UCLA. My master's it's in health policy, and my PhD is in epidemiology. That really combination of data is really critical. And then so I learned more, I have more experience I was a kind of clinical fellow in the kind of Los Angeles County, and then so housing projects, and seeing more of the kind of like need on the kind of in the communities. But at the same time, at UCLA, that's kind of, I don't know whether some of you have heard Senator Greenland and Helm Augustin, these are the epi gurus, mathematicians and the epidemiologists, and who really pushed me to just, it's a painful process. And I was not that interested in methodology. And I just wanted to just go out and apply. But they pushed me that to understand, to make good policy without understanding methodology and going through the training process, I will not get there. And then so that's where I become really into more of data set. And my data set is 5-year data from LA County Public STD clinics. And then so I had to work on mainframe. And then when I run my, regressions, and I can go up and kind of get a cup of coffee and come back and still running. But that was 1994. And then now things have changed. These things can be done in the week with a kind of click. And that's why you are so lucky. And also you have made so much advances. And so your responsibility to make even more advances is crucial, because we started in a very primitive way. But now take a look at it. Within 30 years, things have changed so much. And then so I started to appreciate a lot and on respect on data science and research in health systems. And then also I realized that when we were walking through this, there's an interdependency of domestic and global health. Because we are making a lot of, advances in research through collaboration with different research sites like yours. Next one, please. So these are some of my mentors, and that is kind of Romers, Breslow's, and Browns, and they are really incredible people. And I will think some of them pass away. I always that they are always in my heart, because without them, I will not be who I am. Next one, please. So after PhD, I still want to go back to Burma, and I was not allowed to, and I was not able to do that. And then so I went to CDC, Epidemic Intelligence Service. It was not in my plan. And the Dr. Bill Faggy from the gave me a very good mentorship, and then he really guided me, and Dr. Ward Cates, and then Ruth and Milton Romers. And then so the reason for saying that is a person like me coming from a developing country and have my own ideas. And I really did not understand the options. I did not really, I'm not interested in those options. I don't want to stay in America. I want to go back. I would like to go back to Burma. I would like to just do something in the let's change systems. But they said, look, be patient. You still need more training. You still need more exposure. You still need more networks. When you go back, what are you going to do? You are not allowed to be even back. And so there was really a very difficult time. And however, their patience, their guidance, and their support, and they're listening to me and just telling me what I should be doing, and to make me realize that that's the mentorship that I truly value. And then again, what I'm trying to do now is pay it forward. And, that's one thing I can do. And that's what I hope that all of you will be doing as well. And then so I went to, but I would like to go to a state with a lot of problems and limited resources. And I did not want to stay in Atlanta. And I was supposed to be in doing more in Atlanta, but I said, I would like to go. So I selected Kentucky. And then that's the place I have, worked with, disadvantaged, African Americans, Hispanics, and Asians, but I have never worked with disadvantaged, Caucasians. And then 92% of the population of Kentucky are Caucasians. And it was really interesting for me to understand about life in the Appalachia, and then life in, Kentucky. And so it was really, disease outbreaks, and then from the coal mining and the community to some of the nuns. And then that's really an incredible experience. But the mentorship from Atlanta CDC and all my colleagues really made me understand how to really find ways to work in a country and the populations, which is very different from me. And it was just, really, kind of like I became really good friends of them, and I became an honorary member of the Prestonsburg City's Fire Department. That's in Eastern Kentucky, where it's just, a lot of people from Louisville, and kind of that they don't even want to go there because they're very remote. And then I really connected with them, walked through with them, and kind of, so this is kind of like the reason was that all the mentorship and then coaching and kind of guidance that I have from the people, including my parents, that's the critical for me to move forward. Next, please. And then I took I would like to go back to Asia. And then so after EIS, I took a Hopkins faculty position, but because they are based in Chiang Mai, I don't want to be in Baltimore, so I had to stay in Baltimore, and I had to teach, and others were wonderful. Hopkins, I love Hopkins, but I decided to take that position because I went back to Chiang Mai, which is very close to Burma. And we had a very successful research team building up projects, and then so drug use and HIV, and I had a lot of just mentorship to postdoc and students, and then it's kind of young faculty, and then so, and it was a very successful project because we had to really look into research, and it's very, we had to write a lot of grants and very successful grants and recognition because of the people that we work together with, and then also the most important parts are the collaborators and colleagues in Northern Thailand. They are the one who make it happen. So I started to appreciate a lot more about the differences between the kind of, I did not speak Thai at that time. And so we need to look into different language and that kind of approach. And then, but it was there was a really, so meaning the reason for saying that is I was into very, kind of keen research, and we published a lot of papers, and then we moved forward. Next one, please. And also while doing it, I train and support ethnic Burmese, and Burmese health workers along the border, and I volunteer in weekends. And so so I still try to fulfill what my goal is. But my focus was on research as well, as I say, but in my own time, I went over and train people and support them. So next one, please. And at that time, I was really facing kind of challenging self-conflicts in both professional and personal directions. And so I did not know whether I should stay with kind of as a faculty, and do I want to just be kind of like a professor and I'm going to stay in Hopkins? That's not my goal. My goal is to change health systems. But at the same time, it is very convenient, and I was successful, and I'm moving forward. And then so I had to really consult with many people, including, kind of like some people who are from academia as well as out of academia. Next, please. And so I followed my personal compass to move on to implementation and policy development. And then I had a kind of wonderful more than 5 years at Hopkins, but I move on. Next one, please. These are some of my colleagues, and then the wonderful experience that I had in Asia. Next, please. And so, and also, I want to work in the kind of UN system because, as kind of a young person, the developing country, we look up to the UN at that time. And then, so UNAIDS is very important. And so I work in UNAIDS, and then I realized that, that they don't have money, manpower, and mandate at the time. So I move on. Next, please. FHI, because I want to be implementer. I just don't want, and after policies and kind of like guidelines for, I wanted to implement. And so I went to FHI and work as kind of senior advisor for, drug use and HIV and Vietnam, China, Cambodia, all the areas that, and it's been, implementation is really critical. But I want it to be very evidence-based approach. And so that's why we really need to make sure that we keep working with the mentors in academia, as well as making sure that they are doing what we need to be doing in implementation on the site and on the kind of in the field. And then also, of course, we develop training curricular treatment guidelines. And then I decided that I would like to move from international NGO role to multi-lat for more policy and strategies. Next one, please. So I went to WHO Thailand, and then I'm on the at the decision-making table, and then I led the WHO Thai program on universal access. And again, it's like WHO has a different approach than, by the way, in FHI, my mentor is Award Cates and other people who have guided me when I was at CDC. And then WHO, same thing. And a lot of people who are working at WHO really guide me. And then although I, stay on my own way, and I just, make my own path. And then, but it's that's why I started to realize that mentoring doesn't have to be just one-on-one all the time, that people can really pick up and just, keep giving us some support. Next one, please. And then I, gonna want to move on to more global. So I went to global Geneva, and I worked on the WHO World Health Report on primary healthcare. Next one, please. I realized that I'm just talking. That's time is a little bit short. And then after that, I went back to CDC because I would like to really have an opportunity to walk in and learn from you in Africa. If you want to help in development without experience in Africa, I don't think it is complete. And then so I accepted in resident advisor position to lead CDC and a FELTP program based in Nairobi. And then, but I was, helping, the people, from Uganda, Kenya, South Sudan, Tanzania, and even Ghana. And then so my supportive wife and the family, we moved back to the US, and while waiting for relocation in Kenya. Next one, please. So this is what I work on: preparedness and response for disease outbreaks in health systems, as well as non-communicable diseases, and then collaboration. And then so that really helped me understand a country like South Sudan, and then struggle, and in Kenya, and there was that time as 2007, and then post-election struggles. And then so that's a kind of very challenging time, although I'm focusing on mentoring the young and mid-level brilliant people. And then I had to really look into the ethnic tension, because some of the residents cannot be in different parts of the country. And then so that's where you start to look at that mentorship is beyond just technical. It is really about life, and share my experience, and they're like Burma, and some of them appreciate it a lot. And then that's saying I appreciate a lot about their struggles as well. Next one, please. So, but it also, we have a lot of challenges and a lot of progress as well, because of everyone is very committed to what they are trying to do. And then so I spent a lot of time in the evenings and nights, and mentoring, counseling, and discussing, and then where they go from after their residency. And I was in thesis advisors, and so it was a really wonderful experience for me, although it was very challenging. Next one, please. And then so again, it's like when we are working on it's a research, policy, evaluation, and improvement of service through research. These are the areas that we really work through at CDC as in my role. Next one, please. So then I realized that it's it is not just research, and we also need to mobilize more resources to improve the research capacity and workforce development. So again, I move on. Next, please. So, when I was in both Africa and Asia, I did not like headquarters sometimes, because I thought headquarters doesn't understand us. And then so I would like to go back to headquarters and share my experience, and try to make the difference. Next one, please. And I realized I would had a great opportunity to be with the US, NIH Fogarty program, and then I became a program director for fellows and scholars, and then And we created Fulbright Fogarty, and then kind of like really keep pushing on trauma and kind of injury research training. And the most wonderful one that kind of what everyone is wonderful, but in Medical Education Partnership Initiative was the kind of like that's the one which really broadened my vision and scope and the understanding more about the systems and then the needs. And then so this is maybe I was kind of team lead for the NIH, and then so this is I work with many of you and many of the institutions. UKZN is one of the part of it, and then also. What under many challenges, I was able to initiate and establish Fogarty Mentorship Fellows Program. And that was, one of my colleague and kind of very kind of like one of the leaders told me that we don't need mentorship. And then so we should not be creating that kind of fellow program because it's not needed. And so we are kind of he's a very established person. And he said, I did not get training for mentorship, but I mentor people. So I said, okay, are you sure? And that's kind of what it is, it's really needed and we really need to push. But with all the kind of like support from the PIs and the colleagues, and we were able to establish, and now that program, it kind of flies. And I'm really kind of humble and proud to be a part of it. Next one. So these are some of my colleagues. Many of you are there. So I would like to kind of particularly point out Professor Bongani Mayose. And he was amazing. And so I was very impatient. And, that scientist that came over and said that, Bongani, and then why, are your, fellows all non-Africans? And then he looked at me and said, Razak, you want the best for your fellows program, correct? I said, yes. This is the best I have. But if you would like to really see that the way that you talk about that in the real South Africa, you need to help us train others who did not have the opportunity to be the best yet. And he took me to the University of Western Cape. And so I was able to kind of create some support for Western Cape. And within 2 years, the Fogarty Fellows Program, people from Western Cape and other Africans are coming through. So Bongani and Professor Mayose really helped me understand a few areas. Although, he's not my mentor, but he taught me something that which I was not patient, and I was trying to be so this is the context, the African context that he really showed me. And also kind of James, Hakeem, and who was from South Sudan and went to Uganda, to Kenya and all of the different places. And James and I talk a lot of times about, our backgrounds are quite similar, and our desire to help our native countries. And he passed away with COVID. Next, please. So I may continue to explore and search better approaches to strengthen global health, services. And I was blessed with great colleagues and mentors. And like I mentioned before, next, please. I'm going to go move faster so that way we can get out. And then I moved to Office of Global Health Coordinators, and then I became a senior advisor, understanding more of diplomacy and how do we really walk through this. And I was able to support the resilient and responsive health systems and skills sharing in the professional training and other capacity building programs in America and headquarters. And that's what I really learned about how headquarters, and I started to appreciate the things that they have to do, things that we have to do in headquarters to provide support to the kind of implementers. Next one, please. And then I decided to return to the front line in Asia after 13 years in headquarters in DC and in the Maryland area. Next one, please. These are some of my mentors. I'm not going to go through this, and I was really lucky to have many great mentors. Next one, please. So, let's talk about data science. And then so all of you are more familiar with data science, advanced data science than me now, in a more of a scientific approach. What I'm looking at is I'm looking at application. And I would like to make sure that data collection, verification, analysis, interpretation, and utilization is the best they can ever be and keep advancing. Because we become sometimes lazy. We have so much data available, and how the verification and representation of the data. And I know that all of you are paying attention to it, but in the field, in the districts and provinces, and how information is provided. And if we don't pay attention to it, and we all say that garbage in, garbage out. And no matter how brilliant your instruments are and the softwares are, and how we really collect information and how we verify them, it's really critical. So I would like to make sure that this is a part of the things that you are continue doing it, and you will pay more attention to it, because sometimes I get lost in the wonderful softwares. I love the softwares, and then I just play with them, but we need to pay attention to where the data is coming from now, especially now, misinformation, disinformation, and the kind of data manipulation. These are the areas that I hope that you are really going to be looking through, that your mentors and mentees working together to make sure that that's one of the areas that you focus on. Next one, please. So applicability in health. And it is just, data science is like for investigations, and then for test, diagnostic, preventive, promotive, curative, rehabilitative services. Everything requires data. And advances needs to be in a kind of, for me, I'm talking from my perspective as a kind of like end user. I would like to make sure that we are getting the best data science and the methods and application, and you keep moving forward. And that's what we need. And then so this is where I look into the data science. And as I mentioned to you before, I was in a kind of like with a lot of advanced data analysis and others. But the more I stay in the field, the more I realize that we still need to continue doing it. Next one, please. So more advances for better application. In that case, for whom? It is for software developers. And then, but for me, everything is about the people. My bosses are people in needs. My bosses are people in streets. So please, that's my plea. Data science, keep making sure that, we keep our focus on who we are trying to serve. But some of you just maybe like working for some people who are kind of like very in the big public, in a private organization. That's fine too. But but please keep looking at us, and then also for the people who have brought you, and then who have provided you your education, your training, and then so people need you more. Next, please. So what is global health? And I'm not going to go through this, kind of like not just physical, mental, and social well-being, not merely the absence of, disease and infirmity. And then so when we are looking into that, how do we really improve health, and how data science is going to be helping global health? Because as you know, the world is getting smaller, and then we get data, it's going to be a kind of explosion of data. And how do we really make sure that we are not forgetting and kind of like missing any segments? Next one, please. So this is a global health, and kind of like that kind of Julio Frank mentioned about it. And it's not just about regardless of geographical position or stage of development. That's where we have to work together. And that's what I think US is trying to do. And also, pandemic made us aware of the interdependency of all countries in the world. So that's data, and where we are looking at, and how we are really just going to be helping each other, and how the development in the kind of science can really help us all. Next one, please. So again, it's like African context. When I heard African context, I like to just know how do you define African context? Next, please. Because for me, it's like, Africans in Africa, African temporally in different countries, African diasporas, not, non-Africans in Africa, and who deeply care about Africa and committed to the continent, like me. And then so when we look into African context, like Wafai came back. But he's an American, but he's walking through this. And so he's really approaching an African context. And all of, and you are very committed to making African, I'm very proud to have a chance to work with, in Africa and be exposed to Africa and then still care about Africa, because this is really critical for me is, please, hopefully you can define African context. That's my questions to all of you. Next one, please. And the push and pull factors for African workforce: to stay or to go? And what keep you stay? What keep you go? And what keep me stay? What keep me go? And these are the areas that we really need to look into that. And so this is where another point is data science come into that, both qualitative and quantitative. That's another important issue I would like to just raise. Next one, please. So, and that's availability and support for required resources to stay and thrive. It's not just technical, financial, political, and human resources. Mentors in different places can really help us to really think and plan. Next one, please. Now, can you just hold it for a minute? So I love Miriam Makeba. That's the best concert I've ever been to. In 1994 in Los Angeles. And then, so I like what she's, it's eyes on tomorrow and feet on today. So we can really talk a lot about the future, but we have to stay on our feet yesterday. How can academic institutions strengthen mentorship for African workforce with a focus on data science and global health? So this is really critical. I'm just focusing on academic institution because you are in the academic institution. How can you strengthen it? And I'll just go step by step. And also mentoring is unfunded, but expected activity for faculty in most institutions. And then so when mentoring, but previously there's no funding for mentoring. And so how can we really make sure that we are putting effort to keep supporting and keep learning? Next one, please. So let's look at the different stages of mentorship in academic institutions. Undergrad, graduate, postdoc, early career faculty, established faculty, university leadership and management. And so every step and every stage requires mentorship, but they are different. And all of you know that. And so how do we really make sure that we are putting our effort into the right place? Next one, please. So strategy and action steps on mentoring of each stage can be developed. And that is very important. How do you develop for undergrad and post, graduate students, and how do you early career faculty? These are the areas that we will need to be looking into. Because how, the next one, please. Not every teacher and faculty can be a mentor. So don't force everyone to be a mentor. If they're not prepared, supportive, and interested in it, it will not be. They can be great researchers, but they may not be great mentors. So just make sure that the way that you select a mentor. Next one. If a university is committed to mentoring, develop action plans and support like you're doing now. And then, but it has to be really just going in deeper into that. That's what, I love doing it, and I'm trying to do what I can for people. And then, but I'm in a practice, and then so universities have to really take a look into that. Next one, please. Mentoring should not be limited to academic institutions to expand it, to expand the reach. As I mentioned, some of you will go to private sector. Some of you will go to public sector. Some of you may be independent. And then so we have to reach out to all sectors from academic institutions so we can really provide what is cutting edge technology and the kind of thinking to them, and also bringing back their practices like all of you are doing now. And then, so that's why sometimes, academic institutions, all of us have to write grants and then kind of, attend kind of faculty, kind of senate and meetings, and it's so exhausting. But we really have to be really making sure that giving effort to mentoring. Next one, please. In collaboration, I think Wafai mentioned about it. And so this is the public and private sectors through alumni networks. You have alumni network, and the alumni can be mentors. How do we really strengthen the collaboration as well as impact? And this is global whole workforce. Some of you may move on to different places, different countries within Africa or outside Africa, and some of you will stay. And then having this, like network of alumni and the mentors are really critical. So we need to really make sure that it is, like supported. Next one, please. Bring in practice leaders and workers to share the experience and insights for trainees and link them for mentorship. So all of you are doing it. And then we need to keep doing more, because we need to have the pulse of the cutting edge, especially in data science. Private companies are critical, and they are way advanced in many ways. And then, so this is where we really need to bring them and kind of make sure that kind of mentorship and how they can really help people, and they kind of like not only teaching and sharing and mentoring them for the career path. Next one, please. So, and also offer faculty with appropriate expertise to link with the teams of private or public agencies for technical mentorship. And then, so this is what I tried to create when I was, in some of the institutes. And so making sure the faculty, when I was a faculty at Hopkins, I was invited to WHO kind of panel, kind of like in the work groups, and then also kind of some of the NIH technical guideline development. And so this really is helpful. So what I started to see is not only that I was able to contribute what I learned, and also I am learning from the people who are really cutting edge and kind of practical approaches. And then I found some of the mentors from them, and also I had to mentor others. And so this is a really key approach. So this slide is the one that I really would like to share with you about how I see from the employer, what I see from the supporter perspective. Next one, please. So this is my heroes, one of my heroes. There can be no greater gift than that of giving one's time and energy to help others without expecting anything in return. This is part of mentorship. But of course, we expect something in return is for them to just do better. And then so this is where I really feel that all of us and all of you who are mentors of different stages, and there can be no greater gift than time and energy and for mentorship. And with that, I would like to thank you for listening, and I would love to just kind of like work with you more, and then make the mentorship a cornerstone of everyone's career path. And thank you. Can you bring the last slide, please? Next one. Okay, I think I don't need the next one. So I just want to kind of show that whatever we do is for the kind of future, and the kind of there's a kind of beautiful African children in the kind of the one. So great. Thank you very much.
Importance of thinking of systems, which tend to be complex, but are important considerations as we sort of move through the world in our own lifetimes and our aspirations to make a contribution. And the value of mentors in guiding us through this journey and through these efforts to dissect the complexity and come up with solutions, ultimately to focus on people whom we all aspire to serve, regardless of what we are trying to do in data science of our various domains. We have some time for comments or questions. If there is anybody who has, please raise your hand, and there is a roving mic. If I could, while you take the courage, and yes, there is a question there, so I'll hold off my question since there is a good question in the audience. Please go ahead. Saloshni Naidu.
Thank you very much. And thank you, Maitreya, for that presentation. It's much appreciated. I just want to say, I noted your definition of a mentor. And in my experience, what I've come to appreciate and realize is that mentorship is a two-way street. So while people traditionally think of mentorship as being a senior person mentoring a junior person, what I've learned and what I've seen is that we also have some senior people who get directly or indirectly mentored by so-called junior staff. And so I think we must be open to that there's this two-way street. And so maybe that definition of mentorship needs to be revised somewhere along the line. Thanks.
So if I could ask you, Miatu, if you could comment on that aspect. And a related point, really. One that Saloshni is raising, that mentors can benefit from that relationship. But could I also ask you, what are the expectations of mentees in that, so that they derive the maximum benefit, and it's not just waiting for the more experienced guy to tell them what to do next? How do you see this sort of relationship?
Great points, Professor Naidu, and I really appreciate it. This is, as a mentor, and we gain so much from the experience of so-called mentees. And this is kind of it's a two-way track, as you mentioned. And then this is one of the kind of like the definitions that, kind of like highly accepted, kind of like widely accepted. That's why I'm using it. But yes, we should have a definition of like, or kind of addition of how mentor-mentee relationship is beneficial for everyone. And especially kind of mentors gain a lot from the mentees. And I have gained a lot from the people that I have mentored. And I think that some of my mentors told me that, and I challenged them, and then so they appreciate it, and that's really critical. And then I'm sorry that Wafai, I forgot your question.
Mentee in deriving some maximal benefit from this, instead of being passive, does the mentee have a role to play in maximizing benefit out of the relationship?
Absolutely, and there's not, mentor-mentee relationship is not passive at all, and then the more engaged the mentees are, because when I was, being mentored, and I went and talked, and I challenged them, and I did not listen to them. And when they are telling me that you should be doing in this direction, I said, no, that's what I did not want. And then so I challenge, but my mentors are so patient, and they're like saints. And then they just patiently telling me why, the reasons. And then so, but some of the areas that I told them that, like, I'll give you one example of my surgery, professor. And then so they wanted me to be in surgery, and they would like to meet the professor and head of the surgery, and that's my path. And however, I said, no, I want to change my career, and I want to be in health system. I have to walk through this. And they just listened to me, and again, they said, look, said, I have that, history of my political movements. And so they said, yeah, we understand. You can move forward. But let me tell you this. In health systems, or in the public health, there's no money, no prestige. And you have to deal with politicians. Be prepared for it. And that one stay with me. And then also they really appreciate that, I was pushing for health system the way that I wanted to go. And they keep helping me understand what is needed in the path. And so the point for me is, yes, mentee has to be active. And then also mentors have to be active. And because mentees is not telling something, and the mentors have to ask questions. So they are some of the core, competencies of the mentors that which we can discuss a lot more. But for the moment, it's like, because time limitation, I cannot go into deeper. But these are the good points, and that's one thing that we must be doing it. Back to you.
Very helpful. I just noted that there is a large audience also online, so that's wonderful. And there is a question in the chat. We'll take a couple of questions, one from the chat, and if there are any others from online or from here in the room. So the question in the chat, Miatu, is how many mentors do you suggest one should have at a time? And should they be in the same field of research of the mentee, I suppose?
I think it depends on what your goal is. That's why when I talk about compatibility is like, like your goals. And then so sometimes we have more than one goal. And so you should have more than one mentor. If that's what you have kind of like, I had a lot of conflicting interests. So I had a lot of mentors from different fields and I listened to them. And then so in research, but this is about teaching. And if you're looking about research methods, and find somebody that you trust and you can really listen to, but at the same time, you will need to explore some other research methods. And this is about research methodology. However, to move forward, you need to fix with somebody who can really guide you and listen to you, and also some of the methods, like there are several methods, and these are the things that I have gone through this, and this is my guidance to you, and what do you think? And go together with the mentee, and that is important. And so how many mentors do you need? It depends on you. And then are all the mentors going to be good? No, it is not likely to be. And then so if you don't think the mentor is good for you, move on. And if a mentor feels a mentee is stuck, and mentor had to just tell them too, like, look, my principles, my values, and my ability to mentor you is not compatible with what you are seeking. And so probably I would like to recommend you to another mentor. I had to do that sometimes, and I had to change my mentors too. And then so it is the very important point is don't be stuck. Be dynamic, be proactive for both mentor and mentee. I hope I answer your question.
All right.
Very helpful. We have time for one more question, and a hand, Coyote.
Okay, thanks, Prof. Yeah, so thank you very much for the presentation, sir. And so what I wanted to, some of my comments have been raised, but to add on to it and ask a question, given that we know it's a two-way street, the mentoring and mentee, how do you, in opposite to what you just answered, how do you deal with the thin line between mentoring and supervising, especially when it comes to answering, for example, very technical questions from a mentee? You know that there's actually a boundary, you just advising and all that. If a mentee kind of keeps pushing the boundaries, how do you get to solve that as a mentor to a mentee without, pushing them back and, making them feel like maybe they're not doing things well or something like that? So that's my question. Thank you.
It is very important. It is, sometimes, kind of supervisor and mentor can be different, right? And then so when a supervisor also is your mentor, it really is a very thin line, as you mentioned. So as a supervisor, I need to make sure that my supervisee is producing what is needed. And I'm talking about the supervisor from the employer perspective. And then also, as a mentor, I have to listen and guide that person to be moving forward. But some people, like you said, would like to cross a line. And because you're my mentor, and then I would like to just kind of like push the boundary, and I cannot do that. And so that's where you have your performance indicators. And so as a supervisor, I will stick with the performance evaluation pattern, and this is what I expect that person to do. And then also, as a mentor, I will guide that person. And then so mentor doesn't have the authority to discipline, promote, or just gonna punish, or just gonna like giving some form of a negative point. And then so that's where we have to just make sure that if supervisee who is a mentee is crossing the line or mentor is crossing the line, we have to stop it. And that's why we need sometimes and some of the institutions guidance. And that's the reason one of my last slide that I mentioned about kind of like having a kind of a plan and SOPs, these are critical because this is the guidance that we need to really push to make sure that this, like, also this field is growing, this field is kind of advancing. And then we will need to just really pay attention to nothing that I'm saying is absolute. And nothing is absolute by any means. And then so what we are looking at is sharing my thoughts, and I would love to listen to your thoughts and listen to your mentoring experience, and then we need to combine together. That's where we have to work together. And so again is supervisor and mentor, and there's kind of very clear line, and supervisor has to be following the requirement from performance indicators, performance kind of evaluation, and then also universities or employers or organizations need to make sure that kind of like this how it can be dealt with. I would love to hear from Coyote and from you later about how you see it and how we can really work together. These are the things that not work together, learn from you about your experience. So if I have some suggestions, I'll be happy to share my suggestions. And then kind of Nisha and some of your organizers have my personal email. Please send it to me, and I'll be happy to share my thoughts.
Oh, thanks very much. Thank you
So much. We could continue for much longer. It's been really wonderful, close to an hour or slightly over. Many lessons that you have shared. One that stands out is it's a be dynamic. It's not a static relationship. Lots of opportunities to sort of tap into mentors of all backgrounds. And the second one, this is a field that's growing for us. We are all learning how to do it. It's not something that has been the focus for some time, but increasingly it is receiving attention. There are competencies that can be sort of imparted on each of us, and we can learn from each other as we advance forward. And as we become beneficiaries of mentorship, as Dr. Razak mentioned, we ought to pay it forward as he has done through his life experience. So grateful for your time. It is past 8 o'clock in Vietnam, and we really appreciate that you shared with us these experiences and look forward to continued interaction. Thank you so much, Dr. Razak.
Thank you very much. Thank you very much for invitation, and I really kind of hope that we can continue discussing. And then best wishes to all of you. And then I think you're the leaders, and then we need you to take us to the next level. Bye-bye.
Thank you so much. Take care. Now, let me ask my boss, Nisha, what happens now? Nisha says strictly 5 minutes. So at 3:40, we will be back here and we will start with the next segment, an exciting next part of the agenda. Thank you so much. So stretch, sorry, Nisha, to put you on the spot. Is there tea or coffee out there? So when you go out, on your right, there is some tea and coffee and some snacks. And see you back in exactly 5 minutes. كيف أخبارك؟ كله تمام؟ كيف البابا؟ 2 years old? 2 years. You have one? Bye. continues to be a partner and friend and colleague to me and to many of us. So Till, over to you. Thank you so much.
Yeah, thank you, Wafai, and great honor to introduce our panel. I'll start off with a few thoughts. So we'll talk about, and panel, you're all so experienced and professional. We didn't really prepare, but we do have a joint vision. And I do know that you will all wonderfully perform. We want to reflect on mentorship experiences, and in particular, your personal experiences, and in particular, experiences in mentoring people in data science, in the mathematicals, in quantitative science, which has specific challenges and specific opportunities, I think. Thank you, Prof. Mandi, Henry. Thank you, Musa in absentia. Thank you, Prof. Anil, for welcoming and hosting us at UKZN. And thank you, Saloshni, Prof. Saloshni and Nish, for your fantastic work here in our hub in UKZN in this DSI-Africa for data science and the global health priorities that we are tackling with data science approaches here, health systems on the one hand, and then Nish, that's one of your areas of deep expertise, and then Wafai, one of your areas of deep expertise, nutrition, environmental health, climate change, and health. So 2 areas that critically need data science, big data competence, and novel analytical methods for insight. I want to share 2 slightly personal points at the outset. Many of you will know that Wafai is one of my main mentors in my life. And when I think about institutional challenges on the one hand and entrepreneurial science activities, opportunities, I channel Wafai and I think, what would Wafai do, right? That's what a good mentor does. He gives you a mental image that guides your behavior in the long term. And Wafai, you are one of my mentors and major models in this way. And then what many of you will not know, I was formerly one of Musa's mentor. When Musa had his Welcome Development, Career Development Award, I was his primary mentor, but in all honesty, I learned more from Musa than he learned from me. But we mutually mentored, and maybe I taught him a trick or 2. And when Musa recently was considering moving in his career, advancing to other position, he called me and said, Till, can I bounce off a few ideas? Here's what I want to do. What do you think? So these mentor relationships, they last a lifetime and really become friendships and partnerships in crime, in science, in our enterprise. And then a few thoughts specific here, mentoring in data science. So we might be misjudging mentoring in data science because a lot of data science is very mechanical, it's very technical, and those skills can actually be taught online, they can be taught in textbooks, they're taught by practice. So it might seem data science actually doesn't require very deep mentoring. I think the opposite is true, because there is an art to data science, and there's always the art of leadership in data science and leadership in science in general. The specific skills that a data scientist needs to have, they are actually high-level art skills, and those need to be mentored. Those are not available online. Those cannot be learned from a textbook, and they include how we communicate, how we work in data scientific teams across the entire value chain of data science, from data collection, field worker training, to data quality control, critically also communicating emerging results. The art of visualization is something that needs to be mentored. I think it's hard to learn that. It's an art. And then, of course, the leadership when we grow data scientific teams, because now we are herding the most educated people on the planet and the most looked after and sought after people, data scientists, computer scientists. So we need to be especially good leaders to attract them to our institutions, to our projects, and to retain them in our teams. If we're not good in leading those teams, they go to the private sector where they earn 4 times as much as they earn with us. But we offer the intrinsically motivating, exciting research opportunities to computer scientists and data scientists. So I very much look forward to learning from you, our panel, and just to introduce each of you in no particular order. I hope I have a complete list here. So I start with David. David, maybe because you are the most senior inter pares, we have major senior colleagues here and mid-career people. So David Kubatute, most of you know him from his research over decades, really shaping chronic disease epidemiology in Africa and globally. David is professor of epidemiology and biostatistics at the School of Public Health at Makerere University, East Africa, if I may say so, best university, highest ranked university in Uganda. Candida Moshiro, equally senior, is professor of biostatistics at the Muhimbili University of Health and Allied Sciences, MUHAS in Tanzania, another leading, I think the leading medical university in East Africa. And Angela Chukwu, hello, Angela, is professor of statistics and the head of the International Partnerships Enterprise at the University of Ibadan Research Foundation at Ibadan University in Nigeria. And then we have 3 powerfully emerging mid-career researchers. Mohamed Mohamed is earned his PhD here at UKZN. He's now in our DSI mentorship group and doing wonderful work, clustering analyses, amongst others, on multi-morbid syndemicities in African countries and predictive analysis, really an outstanding talent. And we are grateful to UKZN to have recruited and trained him in such an outstanding way, including Henry. Thank you for your work here in providing talent for data science. And then Isabel Mazzorera is at UC Berkeley and is assistant professor of public health nutrition, working a lot in our nutrition stream in DSI-Africa with Wafai, with others. So welcome and very excited to hear from your particular perspective, Isabel. And last but not least, Sandra Barthet is group lead on digital health interventions at Heidelberg Institute of Global Health and has a multifaceted data science background, including a master's in computer linguistics originally, a PhD in public health, and now a master's in data science from Georgia Tech, which is, I think, the #1 ranked analytics institution, one of the new Ivies in the United States, sort of the MIT of the South. So Sandra, also great to hear your perspective and in particular on mentoring, of course, your growing team. So how do we do this? Do I remain here or should I join you with I think it's nicer. Oh, can we turn this on as well? Yes. Join. Yeah, maybe starting in this way, so we have a naturally, organically found order. So starting with you, Mohamed, you have 2 perspectives, right? You are a mentor, emerging as a mentor, but you're also still a mentee and working with mentors, including many of us here in the room. So starting with your thoughts, mentoring for data science from this dual perspective that you currently have.
All right, thank you so much. My name is Mohamed Mohammed. I'm honored to be in this panel discussion as a postdoctoral fellow. So my views regarding the mentorship in the Washatakumu program, where I am one of the first cohort in this program is that it was helping me actually to develop my skills, enhance my knowledge, and actually my mentors were very helpful in guiding me through this journey until I reached this point where become like kind of a, they taking me to the beyond independent researcher and becoming as a mentor in the future. So I would like to thank all of them in this particular event here. As for example, one of the chances that they gave me, Prof. Henry Mwambi, he gave me a chance to be one of to co-supervise one of his postgraduate students. So that is a great chance which helped me to start my journey as an independent researcher. Also, one of the things that they do help with making the resources available wherever I need, like data or any other resources that I need, facilities, anything, they are always there to help and make things easier so that we can all achieve the main role of the program. I remember one of the things that I had in this program when I started. Actually, I had a problem of getting data to do my research, and then once I raised that concern, all of them, they were very helpful. Particularly Prof. Wafai Fauzi, Dr. Sandra as well. They have all helped me to get access to data set, which I wasn't able to get without their help actually. So their role is very important, and it's crucial to, to help us help me in becoming an independent researcher so that I can kind of, become a mentor and bit of and contribute to the next generation of the researchers. Yeah, thank you.
Mohanad, not to put you on the spot, but from your perspective, what are your unmet mentoring needs? What more do you feel in your own career would be useful? Mentoring and the need for mentoring never stops. And right now, anything that is missing that we and others could provide better, more efficiently, more frequently? Any thoughts?
Thank you, Prof. Yes, actually, the role of mentors doesn't stop at a particular point. So it will continue, actually, and wherever there's needs raised, I'm sure that I will find them there to help. Things that they may, they can help is in building my careers. Like, they can help me in, for example, like getting opportunities where I can involve in a lot of task or research where I can increase and enhance my skills. So that is I think that would be the best for the mentors to be continue supporting, always in and continue to support in giving task, making their mentees, are always involved in their in different tasks and research, so that they can keep that momentum and go forward. Then in that case, they will transfer the knowledge to the next generation, and that will keep the researchers with the very we get a very highly skilled researcher at the end, and that will help to transfer knowledge from generation to the next generation.
So Candida, you have mentored and trained quantitative scientists over decades. What are your thoughts in this specific field, data science, which you are also, of course, powerfully mentoring in now?
Thank you, Till. First of all, I'm happy to be part of this team and this very important agenda that we're moving forward in data science. It is relatively new. And should just take note that since it's quite new, so we don't have that quite an enough number of knowledgeable mentors yet in most of our institutions, including where I come from at MUHAS. So, but within our team here, we have at least an adequate number, I would say, of expertise, whereby our mentees could be well mentored, and that is happening. And that is because we're collaborating with institutions that have that capacity. So for institutions like mine, we hope to grow in the future. We hope to build that capacity. So we also expect to be mentees of these, other institutions, strong institutions. That's how I see it. So, and currently now a lot of mentorship relationships exist within the project. So we have postdocs who are mentored by a team of mentors. I'm one of the mentors for a postdoc, Tanzanian postdoc, who started recently. And for him, we are a team of 5 mentors. It's quite a large team, but with different expertise. So everyone is bringing in a different kind of support, level of support. So I hope we'll see how that goes. I hope that won't be too much for him. So as you know, sometimes having more than 2 mentors, sometimes it's an issue, it's a problem. For my PhD, I had 3 mentors. Well, Dr. Razak said some are supervisors or mentors. So anyway, whether the supervisors or mentors, but I had 3 such mentors. It was good, but the mentee has to be very, very proactive. And you as the mentee, you are the one who has to drive that agenda. You have to make sure the meetings are being held. You have to remind your mentors. Actually, you have to set the meetings. You have to say, I need a meeting. I need to meet you. I need to meet with you, because you want to be guided by them. So you have to be the one who is driving that. If you do that, then that's fine. So there was a time, and obviously you'll get, sorry, I'm taking a lot of time. So there'll be a time where the 5 of us will have different opinions. Okay, we'll be giving different advices. So which one do you take? So what I used to do, if they disagree, I would say, hey, I need a meeting. Can we have a meeting, please? Yes, so I have the agenda. They don't have the agenda. And then I just go to those points where they differed. So you suggested, well, let's talk about this. A said this, B suggested this. So what do you say? Then I leave it for us to discuss together so that we come to a consensus. Then I become comfortable and I'm not left confused. But in our settings, where for our supervisees, they usually find difficulties in managing such situations, even when they just have 2 mentors. At MUHAS nowadays, it's a rule that for every postgraduate student, he or she should have at least 2, not 1 anymore. So, and these differences exist, they happen. A says this and the other one gives another type of. So the student just collapses and panics and said, what am I going to do now? Should I follow the main mentor or should I follow the co-supervisor? Who should I listen to? So at times for those who I'm working with, I say, hey, you should be proactive and put them together through Zoom. Nowadays, thanks to COVID, we are using Zoom a lot nowadays. Whether it's through Zoom or whether it's a physical meeting, have them sit together and you drive your agenda. You come with your, with your agenda for the meeting because you call the meeting. Then you'll get your issues sorted out very easily. Yeah, let me stop here for now.
And Candida, before you stop, so from working with many Tanzanian colleagues, I know that you're a very sought after mentor yourself. And how did you become such a effective mentor? Did you ever take a formal course, or was it experiential learning only? How have you developed as a mentor?
I'm humbled. Yes, I know. I'm very sought after, but you know what? I think I think it's because maybe I have an open door policy. I listen to anyone. That's it. It's not that I'm that good. I don't think so. It's just that I'm willing to listen to them, I guess. And most times I'm not able to help them. So I kind of direct them to other people. So, but I think the fact that you can listen to someone, that's a big deal. And actually in mentorship, that reminds me something. We are not good listeners, usually. And one of the qualities of a good mentor is you should be a listener, an active listener. You should listen to your mentee. And in that way, you'll get to know a lot about other issues about your mentee, you know, about their personal life, a little bit, because you need to know a little bit. Maybe they're struggling with finances, they can't pay for their fees, they're panicking, they're not sending in their proposal. Why? They can't concentrate. They haven't paid for the fees. But you're there saying, why are you not sending your proposal? Why is your work of bad quality? Whereas the guy is struggling to get fees, school fees. But because you didn't create that environment whereby you would be able to listen, you don't know, you can't tell. I have two students who I supervised. They dropped. They didn't complete their studies. Out of the 50 plus that I've supervised, 2 didn't complete. And it haunts me a lot, and I ask myself, where did I fail? But I know very well that I didn't listen very well. I didn't know I didn't know about their struggles that we're going through. One of them was not even picking up my phone. You call, write an email, no response. Call, you asking him, where are you? Come back. Come and submit your proposal. He doesn't respond. You go through a friend, they tell you, yes, I've met him. So I say, where did I fail? Why is it? He doesn't even want to talk to me. So it means I failed somewhere. So I didn't build that rapport from the beginning to get to know him well, to know what he's going through. Some of them even lose jobs in between. A lot of issues. I can talk until tomorrow. Yeah, thanks.
Super, thank you. David, I would love to have a mentoring/coaching session with you at some point. What are your secrets to mentoring?
Okay, I think, allow me to,
yes,
there's a slide that I prepared. Was requested to talk about mentorship models in the global south. That's it. Yes. So I'm glad that my colleague Candida has almost talked about the different experiences that we go through as we mentor or being mentored over the years, as the I think Dr. Razak mentioned. As you mentor, sometimes you are also being mentored by the individual mentoring. There are things to learn. And I always say that learning never stops. And even when we are teaching, there are things that you learn from almost each student that you teach or mentor. Now, when we're requested about the models, okay. So And these are the mentorship models that I've experienced over time. I've been teaching for over 30 years. And if I were to use a scale of 0 to 10, this is how I would place them. The one, yes. So the one that I have here is, I think this is what most of us are familiar with. And this is where a student is enrolled, for example, in a PhD program. It could be a PhD program, it could be a postdoctoral training program. And most times under this arrangement, this is restricted to achieving academic milestones only. So proposal, they go into their research, collect data, start writing, and then manuscript, and so on. You know, those academic milestones. And in my view, there's minimal mentoring in this kind of arrangement. And I think it has been mentioned, Dr. Razak mentioned, there's a difference between supervising and mentoring. So here, most times, the senior individuals are supervising, and there may be minimal actually mentoring. Sometimes there is. So if I was to put this on a scale of, where's the page? Of a scale of 0 to 10, I would put it towards the 0 in terms of mentoring. But the arrangement that I've found probably more useful in terms of mentoring is where a PhD student or even postdoctoral student, where their work is embedded within a wider research team project activities. And in here, usually the project is written intentionally with the capacity building component, where in addition to the research activities, students are enrolled, either PhD or postdoctoral students. And sometimes these students might even be allowed to lead some components of the research activities. And as they do, so they lead, but under close guidance and supervision of the senior researchers on the project. And over time, I've realized this is a very good model, where over time, the student is achieving their academic goals, but at the same time, they are also being mentored how to even manage a project. Sometimes they're involved in writing reports to the funder, managing budgets. Those are good learning experiences, which are not required for the academic goals, but they are learning experiences that the student or the individual will actually use after they have graduated. Yes, so there's continuous mentoring and continuous learning beyond the PhD academic activities. And under this, our Washa Takimo, I think that is the kind of environment we have had. It is a project, but we have trainees, some at PhD level and some at the postdoctoral training level. And there's a team of senior individuals who provide guidance in what they are doing. And it is continuous, so they continue to learn. They are guided, and the senior researchers or individuals get to understand the objectives or the lifetime goals of the individuals. So they are able to provide guidance to the trainee beyond the academic goals. And then in the middle, what I would put in the middle is students' work is part of, for example, a training grant. Usually, sometimes there might be research activities, but sometimes there are no research activities. So the mentoring opportunity is not as intense as you have in the third model. But it is better than this. where a student just comes with a proposal, they enroll in the university, they are assigned supervisors, and they achieve their activities, publications, and then they go. But here also there's a team. Sometimes individuals are identified as supervisors. They are not, sometimes they may not necessarily be part of the grant, but then because it is a training grant, they are also mentoring opportunities. Yeah, so those are the models that I've experienced. So they may not only apply to our Washatakimu, but they apply to most of the training environments that we have experienced. Thank you very much.
And David, on your scale, is it intensity or is it also quality?
Probably more of intensity. The quality would come with the kind of individuals you have on the project. Yeah, I think it has been mentioned. Sometimes the mentors may not be as good. Yeah, so even when, if they are not good, even when they are in this third model, they may not, the quality may not be good. So, but this demonstrates more of the intensity of mentoring from the other end of the scale to this end of the scale. Yeah, so the quality, I think, is more to do with the experiences of the individuals that are mentoring, their training, and the match between the expertise that the trainee or the mentee is aiming at achieving, and those of the mentors. Yes, and it may vary even across that scale.
And David, if I may, one more follow-up question, another perspective. So you're probably the most senior member of this panel with Candida. Do you still have a mentor?
Yes, I think it is one of the things I mentioned, that learning never stops. Sometimes I say that even the day you die, you learn how to die. Yes, so we do not only learn when we are being mentored by other individuals intentionally, but sometimes by even watching others. So nobody has ever told me that Wafai is going to be your mentor, but I've learned a lot from Wafai. I've learned a lot from you. Yes, so I keep on picking things from other individuals. Sometimes the individuals are more senior than myself. Sometimes, as somebody mentioned, even the students we mentor, sometimes we learn from them. You have heard Candida questioning herself, where did I fail? Okay, so that gives her an opportunity to improve once she has recognized where she has failed with a student. So I learn, even up to now, I continue to learn, and I will continue to learn until I die. Thank you very much.
Great. Yeah. Oh, 30 minutes left. Okay. Angela, no pressure. Your experiences, both as a mentee, but especially, of course, as a mentor, and maybe from this particular perspective, also leading the International Partnerships Initiative at Ibadan Health Foundation.
Okay, so thank you so much, Till, and it's a privilege to be talking to the group here on mentoring. I'd like to start with personal experiences, from my PhD period. And before I start, I'd like to give recognition to Professor Henry Mwambi. I've known Professor Henry for the past 17 years, to be precise. 2017, I was a PhD student. I was younger than this, according to him. I was very young. So, and I remember making a presentation then, and they all had input. I used to have very big interest in infectious disease modeling. And in that IBS meeting, he made a very beautiful presentation on that. And that sparked, a very big interest in me, even though I had a supervisor, because today I know there is a thin line between supervision and mentoring. I had a supervisor who I still go to till today. I was just telling him he's 84 years old. I still go to him. You see, but I never understood what mentoring was all about until about 11 years ago when I came into contact with Professor Ayo. He's a mentor of mentors. He allows you to say everything you want to say. He allows you to tell him about your dreams, your goals, what you want to do. And he starts by advising you. We're not in the same area. He's a medical person, he's a health person. I'm a statistician who has bias in health. And so I tell him, this is what I want to be, so what I want to do, so what I want to do. And he begins to tell you, okay, you do it this way. In fact, up until 10, 11 years ago, I could not develop a concept note for anything. I was just pure mathematical statistician doing my distribution theories, probabilities, and the rest. But coming into contact with people who are real mentors also sparked that interest in me to mentor others. And one thing I know a good mentor does is listening, being empathic, because you have to also be sensitive to what your mentees, their needs. It might not just be the academic thing, so to say. You have to be very sensitive to them. You have to be able to know, in fact, it goes beyond, like I tell people, I say mentoring is a lifelong relationship. It shouldn't just stop at maybe I mentored you for your PhD, your postdocs, and that is there. No, it should be a continuous thing. My supervisor retired about 16 years ago, but I still go to him with issues on academics and, personal growth, my personal growth and all that. And I think that is what every mentee here should also. I've mentored a lot of people. I don't want to use the word supervision because I know I have been mentoring them. I've mentored over 10 PhDs. One who had just defended in Rwanda, the African Center of Excellence in Data Science. At first, he had issues with the data and all that because he was working in capture-recapture modeling and all that. And going through that process was a very big experience for me too, because I also learned from him. And for everybody I have mentored, I have learned one or two things from them. And for those who are with me in the same institutions, my mentee who are still with me there, who are lecturers also, I hear some of them when they talk to students, they say, we were not taught this way. This is not how we were mentored by Professor Angela. And I'll just smile, because it gives me happiness that people could actually pick one or two things from me. I think I'll stop here for now because of time.
Yeah, maybe because of time and to mix it up a little bit, any questions from the audience so far? Any thoughts, comments? Isabel, then over to you. Also mid-career, emerging, rising star situation, you are mentoring, you need mentors. What are your thoughts? And maybe in particular for data science and our field here.
Great, thank you so much, Till, and I'm grateful for this opportunity. I'm here because of mentorship. Actually, I'm here because of mentorship because many people keep asking me which institution am I with? Because on the Washata Kwimu, there's Harvard School of Public Health. I left 2 years ago, almost 3 years ago. But my mentorship with Dr. Fauzi continues to this point that I still continue to collaborate with him. So mentorship, like this is a good example that mentorship doesn't stop when you finish your PhD, you do your postdoc and things like that. What I've learned in life is that we all need door openers, right? You need that person that connects you to, other researchers, other resources. So if you find a door opener, and I do think at HSPH I did find door openers, like, pick such people as your mentors, people that you see have the same interests, and people that have been doing this for much longer. You can learn from them. Till might not remember that I took his class in my first year as a doctoral student in I think it was development. I was like, what is this? I'm a nutritionist and I was studying nutritional epidemiology, but also picking mentors from across the board, not just your own area of expertise. And the one thing that was funny at the Harvard School of Public Health is that I trained in nutrition, but people thought I was in global health because they aligned me with Fafian group, who was in global health. So once I realized my interests were in nutrition, but I wanted to work in Africa. My background is that I am a nutritionist from Zimbabwe. And I started my undergrad in Zimbabwe. And so I really sought out for people that had similar interests to mine. So I feel like as a mentee, there's also a responsibility for the mentee to look out for people that are similar, with similar interests, and people that can support you. But I'll say that there are cultural differences. Like I say, I grew up in an academic setting where you don't want to knock on the professor's door, especially if you're an undergraduate. You're saying, my goodness, this is not something that's expected of us. But for us to thrive as researchers, we have to knock on doors. We have to knock on doors of people that might not be familiar to you and seeking out, expertise and experience across the board. So when I also think about my undergrad experience, one of the things that I wanted, well, I didn't get training in data science as such. I got training in nutritional sciences. And then I started working and realized that I'm interested in data and analysis. And I wonder, as we try to develop data science, do we start with the master's level? How do we, sow that seed for data science even within the undergrads? Because I do think that that's where we need to start. Otherwise, when we start at the master's level, we're missing a lot of interested people that, interested students that might be good for the field, but just have no idea that research is an option. So currently I'm at UC Berkeley, and they think I'm crazy because every year I might have 5 or 6 undergrads, and they say, what are you doing with them? I don't, I enjoy doing that because I just want to bring the idea, particularly for those that are from under-resourced or under areas that are represented in research. Like, how do we bring them into research? Is by providing opportunities for mentorship. And I'm also, as I'm mentoring, I'm also being mentored as an assistant faculty member, assistant professor. I have a mentorship team of 5. That's the UC Berkeley plan. 5 very different people, one in HIV, but she works in Africa. One does, nutrition work and so forth. Because I do think that there's no one mentor that can meet your needs. And for me, it works perfectly because I know if it's something about troubleshooting, about a problem with a project, there's this one that I can go to. If the problem is more technical and more nutritional epidemiology, this is why I approach. So I do think that there are different models for mentorship, but also taking advantage of what's available. In terms of what's one of the challenges that I wanted to mention. So as a junior faculty member, I am interested in mentoring and mentorship, but we don't have time because you're trying, for us in the US, you're trying to get promotion, right? You have 6 years to get promoted and they're counting how many papers you have. Mentorship takes time. And I do feel that as we're developing programs in different countries, that's something that we have to bear in mind. It's not that necessarily people don't want to be mentors, but then you're strained in terms of time. What do you prioritize? Finding the right students that will get you the papers, or developing the students that might need more time, but eventually they'll be good researchers. But we certainly just don't have the time. So I'll stop there for now.
Wow, excellent. And I still think, Isabel, it's very smart to go to a few young mentees because they get smarter and smarter. And but they're different, right? Their preferences, attitudes, so we need to learn because they are our future in our adolescent research agenda. They are our intended beneficiaries. So to have young mentors keeps us in reality and keeps us centered. And I think it's very smart of you, but also of huge value to this world. So thank you for mentoring undergrads. The colleagues say, don't do it, do it. Sandra, so I may get this wrong, but in my mind, you were still a mentee, and now you have this huge team in a very quick time, 9 postdocs, I think. What are your experiences mentoring now a rapidly growing team, major grants that you have won, and all of a sudden you are in your main work a mentor? How are you doing it, and what have you learned?
Many thanks. I can reiterate what Isabel just has said. So I think being in this kind of mid-stage of the career, you're trying to push forward to take the next steps, but at the same time, you have this kind of mentorship role. So which takes time from you. So it's really kind of difficult finding the balance. And oftentimes, I find myself in the position where there's a lot of good applicants just sending through their applications, but I kind of have to reject them because there's just no time to do this realistically, because you also want to be mindful and respectful in this relationship, so that you give the time the person needs and that you're available. And currently I find myself finding a good balance between pushing forward and being available as a mentor. It's not easy to find kind of the sweet spot. I mean, maybe I'll take up Muannat since he started the round. Muannat will also join my team. So I'm very grateful for the Data Science Initiative because he will be starting to work with us on the climate change and health projects, looking at sensor-based data. So where we have a lot of data coming in from different sources, and where we need to kind of tackle this challenge of how to analyze these big data sets and how to bring them together and how to make sense out of it. And as Till said, how to visualize them. So Muannat has already started, and I'm looking forward to further work with him and also to explore opportunities with him to further also strengthen his own individual research profile while we start this journey. So we were already looking into grants that he can apply, also to kind of build up his own projects, kind of rooting off from the work that he will be focusing on once he starts joining us at HI, focusing more on climate change and health, focusing also more on topical content because he's already very strong in data science, but then also taking in this knowledge from climate change and global health while he is with us, and hopefully that strengthens him as well in his journey moving forward as an independent researcher. So Muannat, I'm very grateful for him joining the team and picking that up. And currently in Heidelberg, just to come back a little bit on the DSI program, also in terms of mentorship. So currently we host 3 DSI fellows in Heidelberg. They have joined us in April, and they're just closing their time in Heidelberg that they've spent there. And they have started to also pick up and build up their machine learning experience and started attending courses from the mathematical faculty, but found that it's too mathematically heavy. So they've also proven themselves already quite resourceful in the sense that they have started to explore opportunities even beyond the course, which didn't quite pick up at the space where they were. So currently they have picked up kind of a model of teaching themselves. So essentially they have identified some courses online on machine learning and programming, because these are skills that they haven't yet kind of been taught in the past from their degree. So they go through the courses, and it seems that on a rotational basis, every week somebody else takes on the lecturer role, and they kind of teach themselves machine learning and programming that way, kind of leveraging their time at Heidelberg Institute. But otherwise, they also have been attached in weekly meetings. They have been given office space, so which is at the heart of the institute, so that they have the possibility also to connect with other people from high and exchange. And I've seen that this is happening. So overall, I think it has been quite a fruitful period for them, although they didn't complete the courses as we envisioned them to do, but nevertheless, they found like a resourceful way forward, still kind of picking up their journey in learning data science. So maybe I'll stop here for now.
So Sandra, because this is a perennial issue, and I've also seen it in the short courses, the variability of prior exposures, because we are in a sense across domain and technical knowledge. We have PhD computer scientists, and they're up and running and are bored. And then we have medics who are starting to be data literate, so they come from a domain expertise perspective, very different. How can we be better? And I think these are sort of entry-level mentoring skills in selecting the right courses for people, supporting them, but then also in providing the input that enables students to prepare for the course so they are succeeding, they are successful. So here, in a sense, we failed, and I take that on my cap as well. It's an introductory machine learning course, but it was too massy. So knowing that, how could we avoid in the future that a student is scheduled to take a class that they're not yet fully prepared for, but of course have the cognitive bandwidth to be prepared for within maybe a month or two, right? So what do? Selection, pre-testing, pre-course offerings, boot camps. Any thoughts?
So I also have doctoral students from from medical field, just to add to that, and they have been quite resourceful in picking up skills themselves. So they have picked up kind of a model of teaching each other from online courses. So they basically mix and match according to their expertise. So they mix what or look out what is available. So I've pointed them to a couple of resources. So I did some curation of online materials, which in my point of view seemed very helpful and beneficial for them. And then they kind of took some of these courses, but also met up and exchanged among themselves, kind of teaching themselves through some R scripts, for example. So this worked out quite well because it's highly individual also to your own skills. But yeah, I guess, I mean, there could be boot camps, but then this needs to be organized again and resources invested and so on. So, I mean, the feedback I got from them was very good, and also the outcomes in terms of the scripts they were able to write was very good. So maybe this could be something I can feedback here, that this seems to work very well for people coming from a domain expertise and still kind of getting conversant in R in a short period of time, like maybe in 2-3 months, so that they're able to analyze data and kind of learning from each other, building upon the different scripts and so on. So yeah.
So I think we have 5 minutes. Over to the audience. Questions, comments? Yes.
Thank you so much. My name is James Selubugo, Research Associate from Makerere University School of Public Health. Actually, mine is a great appreciation for this session, because right now I'm connecting the dots accurately. Because we are so opportuned as the trainees of data science to be in this symposium. It had so many elements. As a junior faculty member, now I was like, okay, now I've gotten it, now what? Now a keynote speaker came and started talking about his life, his career. You see, he had a very prolific biosketch. But now he starts picking at different points. You couldn't think he could get there from all the different narrations he really gave us. To me, that was a motivational speech, trying to actually give us insights on how to go about it. I really picked it very well, and that was very commendable. Now, it came to this arrangement you've also made. It has been wonderful. Listening one by one. Now, one said, the culture we are growing up in. You realize as a junior faculty member, there are senior professors. I can assure you there are those I've been fearing to knock at. But now you've given me the confidence to start knocking at people's doors. Yes, I was really fearful and was, how can I go to? But now I've gotten it. Really, thank you so much. This has really, you know, data science, the nature of it, it has this domain, the health science domain, the statistics domain, and then the computer science domain. So now if you need people from this angle, this angle, this angle, we really needed it because we needed these collaborations. We needed the synergies from the different areas to really become better people. Now, thank you so much because you really are to it to see that we become really better data scientists who are really going to get the ground running. Really, thank you. This has been very wonderful. Thank you so much.
Thank you. Any other? Any hands up?
I just wanted to make a practical comment. I mean, Mohan and Gabriel have been intensively involved in delivering the short courses since we've started up to now. And what I know they have not said, the participants are already actively engaging with them. So for me, I think Mohan and Gabriel are already mentors for the participants who have already come through the short course. Thank you very much.
Thank you. Family. Any other hand?
Yeah, thank you. Any last thoughts from our panelists? Mohanad?
Thank you so much. I just want to say that wise people always says that whoever seeks advice will not be disappointed. So we need always to go and knock all the doors where, you know, we have to be like that so that we join all of us together. Even if we are from different domains, we need each other so that we complement and we produce a good product that we can serve and help the humans in the world. Thank you.
Yeah, maybe to summarize, let's knock on doors and open our doors when they're knocked at. And thank you for, oh, there's one more. Yes, Angela, go.
So just one last thought that, you see, in Africa, I don't know if it's in other African countries, but in Nigeria, you know, there is this feeling that lecturers are people you can't just reach. You know, they are there and the students are here. But you see, for some of us, with all sense of humility, some of us have mentored people, because I want to differ a little bit from what Professor David said, that this other side, he will put it at a scale of, you know, close to the zero, but rather say no, because it starts from there. It starts from the undergraduate studies. I have mentored 3 people from the undergraduate studies to their PhD, and they are now colleagues in different universities. So it starts from there. And we shouldn't be weary of mentoring. In the global north, it's so easy. Isabel here, it's a typical example of somebody who have tasted the 2 worlds and has seen the difference. But for colleagues in Africa, and Professor Henry, Professor Tetemesgen, is my new mentor too. So Professor Henry has produced so many and they still refer to him. They still go back to him. So like I said, it's a lifelong relationship. And we shouldn't be weary of mentoring and being mentored at the same time. Thank you very much.
I just wanted to add to what Dr. Angela just said. So mentorship comes with networking. Our culture is also, I'm putting myself in this group because this is something I have to work on. So knocking on doors, networking. If you go to a meeting and there are people that are doing something that you're interested in, I found it hard in the past, but walking up and saying, hello, my name is so-and-so, and I know you do this, and I'm interested in learning more. It doesn't mean that everyone that you reach out to is going to say yes, but you just need one yes. You just need one person to say, oh, okay, I'll give you a chance. So I think networking is part of like this growth that is part of like, mentoring and being proactive in seeking mentorship. So networking, if you go to a meeting, to a scientific symposium, someone is presented on a method that is quite unique or different, or you're interested in, reaching out, getting their email and saying, hey, can I reach out later? That's something I have found also really helpful. But thank you.
Excellent. So yeah, let's finish here. And one thought, just learning so much from you and your reflections, mentee, mentor perspectives. Maybe in the next iteration of DSI-Africa, we hire a mentor coach. So we all learn to be even better mentors, because there's so much to learn from each other and reflect on each other's experiences and do what we've done here now in front of a panel, do that in smaller groups for mutual learning, but maybe with a professional, right? A coach to make us even better mentors, but also even better mentees. That's another skill. Thank you.
After you introduce me, Lena and I have inputs to start our debate.
Okay, no problem.
But I don't know where they put it.
Yeah, no, they'll find it. They'll find it for you. Don't worry. Have you got Prof. Samuel's thing? Just call Prof. Samuel's. And then Prof. Nena. The other two don't have slides.
Okay.
Maybe she wants to.
Sorry?
Okay.
Okay. Oh, because
Yes,
you
we
didn't.
need to,
Okay.
Professor Samuel. Samuel. Yeah.
This slides are here.
And Prof. Samuel. There, it should be there.
Okay,
Yes,
okay, it's here.
yes, yes.
Okay. Okay, let's begin. Yeah. Share it.
Sharing.
Yes. Yeah. Okay.
Good afternoon, everybody. I'm assuming you had your 2-minute break. And so we're going to get to the next section. So for those of you who don't know me, I'm Sloshni Naidu. And I come from the University of KwaZulu-Natal. we've had an excellent session, which gave us an overview of mentorship from the international context and from the African context. So with this session, we're going to bring you a bit closer to home to understand how mentorship is happening at UKZN and in South Africa and in UKZN in higher education. So just know this, as South Africans, we've been raised in an environment of, or a context where we've learned to not just knock on doors, but we turn things around basically so that it's how we want it to be. That's the history we come from. And you will see that even in how academia has evolved in this country. So the idea that a professor's door cannot be knocked on or is superior to you is very, we believe, colonial attitude. And so we have a very different approach to it. So this afternoon, I have 4 really highly acclaimed academics from the University of KwaZulu-Natal. And they're going to speak on different aspects. They'll spend 10 minutes each, and then we will have some time for discussion. So I'm going to introduce my first speaker, who is Professor Michael Samuels. And he's going to present an overview of the significance of mentorship in higher education institutions in South Africa. Just a little bit about Professor Samuels. His background is in education. He comes from the School of Education at UKZN, and he's currently involved in designing and supporting postgraduate studies and mentoring capacity development of supervisors in different contexts across the continent, at UKZN and across the continent. His research interests in higher education studies. He is also interested in curriculum development and professional development. He's got several awards and books to his name. And you can, if you read our symposium list of participants, you will see his full extent of his CV. I'm going to give him the space. Thanks.
Good afternoon, all. I hope that you're all going to remain awake after all of that wonderful provocations that came from various speakers and presenters in the panel. I want to say that they represent a particular club of people with an interest in health science, with an interest in particular ways of organizing postgraduate education. I'm going to disrupt that in the kind of provocations that I'm going to make by speaking from the perspective of higher education studies and how do we think about academic staff professional development in higher education. And from that particular perspective, I'm trying to be able to look at whether the discourse of mentorship is linked to the discourse of performance, outputs, and whether, in fact, this is a disguised promotion exercise. So you can see immediately what I'm doing is that I'm theorizing the scholarship around mentorship. Where does it come from? Why are we obsessed with the idea of mentorship? Why is it developing at this particular point in time in the international literature? Whose interests are being pushed as we think about mentorship, as it becomes part of that agenda? Who's the target group? What are the forms of mentorship? When are we going to engage with mentorship? And what kinds of regulation systems should be used in order to engage with mentorship? I'm arguing that the target group of mentorship is usually junior individuals who want to fast track into the upper echelons. So the last comment from the floor was very interesting. I can now see how I can make it to the top. That seems to be the logic around mentorship. And I'm querying whose interest does this serve. So I'm suggesting that credentialing the professional in higher education has become a growing concern, especially amongst junior academics who lack the teaching capacity. Much of the discussion at the moment has been about the research capacity. I'm arguing that there's another dimension yet of whether academics should be taught how to teach first in higher education, besides the individualistic agenda that they're engaged with. Senior staff will tell you, I don't need to be taught how to teach. I already know my discipline. So I'm asking, who is needing to be mentored, or of only juniors? So I'm saying this concern is that the propositional knowledge is not adequate to be able to activate mentorship. I'm therefore arguing that professionals in higher education is a wide scope. Individuals who are administrative support staff can be mentored. People who are professional services staff, managers should also be mentored as well. And if we think about only mentorship in terms of research mentorship, we're losing focus of how to build higher education systems. So within the university, very many different sources at UKZN compete to mentor individuals. You've got the University Teaching and Learning Office, who are interested in early career, one of its interests in early career academics. You've got the research office. You've got the college level, who's attempting to develop new generation of scholars. You've got a future professors program. And so you see, all of these are agendaed by the notion of promotions and pushing that particular kind of education. The purpose of mentorship is to get ahead. I'm challenging that idea of mentorship in being able to see that when we talk about building the higher education system, we're building the capacity of a university as a system, not feathering the nests of individuals, but trying to ask the question about how are we building the quality of our system. I want to argue that this is not about performance management. It's not disguised performance management, but instead we are arguing that it's about professional growth and development of the entire system. So in a paper that's published in 2018, we challenged the notion of the power dynamics that are embedded in mentorship relationships, and therefore looked for an alternative to be able to talk about a non-hierarchical, co-constructed menu of possibilities. So Loshna, I'm following your agenda to show exactly the question we're asking. Is it a hierarchical relationship that we engage, or are we engaging with a social justice project within the higher education system? It is situated context, mentors and mentees. So I just want to comment on my recent work on what I'm calling savior research and the way in which Africa stages itself in relation to being a recipient of the benevolence of others. And so if we construct ourselves as recipients of others' generosity, and in doing so, we become complicit with a hegemonic agenda that's constructed outside of Africa. So I think therein lies the problem, where the local cultural context of the African context gets superimposed by a worldview of hegemonic practices from the North. And that's what we challenge is this the kind of mentorship we want to work with? So I'm arguing many kinds of mentorships, they've all been discussed, so I'm not going to be discussing them. But I'm saying let's move away from this notion of a hierarchical mentorship to rather instead talk about a systemic understanding of dialogical relationships, a democratic understanding of partnership. So at UKZN, we have a particular idea that if you're an academic, you should be covering those 4 dimensions of what it means to be an academic. And yet, if we listen all day, we have been foregrounding one of those segments primarily. And I'm suggesting if we had to develop a mentorship model, as is discussed in that paper I suggested, that in the teaching dimension, in the research dimension, in the community engagement, service dimension, in the university leadership dimension, all of these are areas that we can develop projects for mentorship. And we need to bring all of these agendas in a co-designed project. That would be an argument of suggesting that would constitute both a professional dimension as well as a personal dimension. And these together constitute the curriculum for mentorship. I want to end with a comment of a recent international comparative education consortium that is exploring the idea of credentialing through formal fellowship programs. Now, in the UK, we have a model that has now become continental in order to allow for migrating individuals across different communities or contexts to be able to talk about how we can exchange qualification credentials. And we now have categories after a senior reflective portfolio of critically engaging fellowship routes, such as an advanced associate fellow, a senior fellow, but embedded in that is an agenda of hegemonic control, is an agenda of saying there is a norm and everyone needs to acclimatize to this particular norm. It will soon become an international form. It's already spreading rapidly through the European context. And now when we engage with this and ask the question, why is it that certain types of institutions are using it now to grade individuals in order for promotion criteria? Besides all of that, you have to pay to be part of this particular program, all right, as a licensing. So we heard in the last closing panel the idea of, should we, instead of mentorships, be talking about partnerships and networks as an alternative to this hierarchical notion? And in a work that I'm doing in the Mauritian context, we explored this idea of what international collaborative partnerships could mean. We've been working there for the last 10 years in producing PhD students with the institution that is not degree awarding, and they have resisted the idea of actually forming any formalized mentorship contractual postdoctoral program. The reason why they argue for this is that they are not as confident about the way in which these programs are being activated in a very hierarchical way, in a way of attempting to impose an agenda onto postdoctoral students. And instead, they opting for a network that is organic and developmental. The same is happening in the South African Educational Research Association, in which there is a challenge to the kind of projects of the fast tracking process of the promotion of doctorates and the future professors in the country. So I want to conclude by asking, why do you think people are becoming less confident in these formalized versions? So in conclusion, I want to say, yes, here's the possibility for this network to ask its question. What is the reasoning between the North-South collaboration? How are we activating in Africa greater scholarship of the South rather than imitation of the North? And in doing so, I think we will be able to rethink the notion of what we mean by a partnership of collaboration around mentorship. I hope that's been sufficiently provocative. Thank you.
Say bring the house down. Okay, so thank you very much for that. I think some very thought-provoking comments there around, sorry, while I try to get my computer started again, around actually looking at building the capacity and the quality within a system and looking at professional growth of the system rather than just focusing on one aspect of mentorship. I think that was quite challenging and important points to take on. So the next speaker is Professor Naina Amin, who is the Interim Director of Teaching and Learning. She's a full professor in the field of curriculum studies and a UKZN Distinguished Teachers recipient. Her research interests include higher education curriculum, teacher education, medical education, and narrative inquiry. She is an NRF-rated researcher and is a co-founder and editor of the journal African Perspectives of Research and Teaching and Learning. She has several other outstanding achievements, including being the recipient of a Fulbright scholarship, and she's going to discuss mentorship with us today. Thanks.
Good afternoon, everyone. I think you all know of Trevor Noah. He wrote a book called Born a Crime. If I had to write my biography, it would be Born an Embarrassment. And that's because my parents were grandparents when I was born, and I was always the evidence of their sexual activity when they should not have been engaging in it. But why I'm talking about it today is that I was given a topic to talk about, did not read the program, just spoke to Nisha on the phone yesterday, and she said, well, we're getting international experiences and we want South African experiences. And so I prepared something about myself. So that's the embarrassment. But let's see how I can draw it again then to the topic, which was what we are doing in the University Teaching and Learning Office in terms of developing a framework for for mentorship. So I'm going to start off by talking about these famous mentors and proteges. So of course, I'll start with Donald Trump, who sees his mentors as Hitler and Hannibal Lecter. And so the whole idea that a mentor is a living, embodied soul is something that I'm going to challenge. And in fact, there's so many things that I could have built on Michael's talk, but we don't have time for that. And so I'm going to talk about me, the wannabe. So when I was young, I found 3 mentors. The first was Mark Twain. And reading Mark Twain at a very early age made me aware about how ridiculous schooling was, because real education is outside of school. And that stayed in my head, but I've never moved away from school. Imagine I'm still at university, okay? So 60 years in education from grade 1 now to university. The second was Lewis Carroll. I was entranced by the creativity, the use of language. And I think that is what has influenced my writing, which is all about paradoxes and ambiguities and ironies and so on. And the third was T.S. Eliot, which brought about a pessimistic understanding of the world, especially after I read The Wasteland. So these were my early, very early mentors. There were many more, but I won't go into that. So these are the mentors from the grave. It's people I never met. They were dead by the time I started reading their works. But I began to see them as mentors. So from Michel Foucault, I learned about governmentality and how we think about history as written by an authority, and that it is a narrative with a beginning and a continuity to who knows when. And he actually looks at the breaks in between. and what constitutes the invisible, unwritten parts of history. And we know that very well in Africa, that we are not in history unless we start rewriting those narratives. Jacques Derrida, of course, is another one that I admire enormously. And I was so depressed when I heard that he was in South Africa in 1994. And I would have had a chance to meet him, but never got it. But through him, I came to understand deconstruction. We intensified my work on ironies, ambiguities, and the issue with language, that language is not a medium for communication because it obfuscates, it cannot capture reality. Louis Althusser was one who brought to me the whole idea of ideology, especially the state apparatus, as an ideological instrument that shapes our thinking, this normative behavior. And then, of course, Gramsci, who made us aware of the role of hegemony, how we think some people have legitimate power to determine what is ethics, what is right, what is morality, even when we don't agree with it. And then, of course, Ernesto Laclau, from whom I began to understand the notion of discourse analysis, how one looks at what is written and what are the meanings between, above, and beyond it. And then, of course, Nietzsche, who is really, I should have started by saying, I was anarchist, I think from my birth. My family always speak about how stubborn I was, how I just didn't listen and did exactly what I wanted to. And so from Nietzsche, the idea that God is dead just resonated with me because as a 5-year-old, I knew there wasn't a God. And so what I was getting through all these mentors from the grave was a confirmation of some half-baked ideas and, some thoughts that I was having about who I am and what space I occupy in the world. And then I have my YouTube mentors. These are ones I listen, and please, some of you should listen to them. They are brilliant, especially Slavoj Žižek. If you ever want to hear someone really open up and make you understand how ideology frames our world and how we, one of the things when I heard about him, about refugees, and just think about this idea where he says, we are so concerned about the refugees that come into our countries and what we should be doing for them. Nobody thinks about those left behind. So if you're running away from war, we're concerned about those that have run away, but what about those that have to live with, so he really makes you think about how we analyze things, that do we only look at what is in front of us, but what is invisible and so on. Giorgio Agamben is a brilliant, he comes from a law perspective, looking at history from ancient Greek and Roman, and really provides deep analysis around issues of power, the state, and so on. And I think by now you would know that I'm deep into political theory. And then Chantal Mouffe, who's the wife of Laclau, was about socialist strategy. So throughout my career, as I got into university and started researching, I began to understand that the theories in education are insufficient to explain what is actually happening in education, and that political theory would give you the language and the concepts to understand it deeper. But I could not get it from those around me. I had to find the mentors myself. Then, of course, these are my contact mentors. These were my supervisors for my master's and PhD, Renuka Vittal, Michael Samuel. You can see why I'm a bigger troublemaker. Yes, because, trouble finds company. And we like gangsters when we move around and do stuff. And what the most powerful thing about these two individuals is just how intelligent they are, which is terrifying when you're a student. And that's one of the reasons I moved my study in a direction that I knew they had no expertise in. So one was political theory and the other was to move into post-structuralism. And both of them took me out one day for a meal and they sat me down and they said, your study has taken a turn. We cannot supervise you. You're going to have to teach us. And so the role reversal started there, this idea about who a mentor and a mentee is. And that changes all the time because sometimes I'm mentoring Michael and at other times Michael is mentoring me. So there is this evolution in the roles. And with my students as well, I've begun to use those same strategies. And by the time the PhD is finished, all my PhDs are my friends. And yet there's mentoring going on. And finally, I have my speed dial mentors. Bert Olivier, who is a philosopher, and Brian Sherrard, who works in family-based counseling. And these are the two people that have salvaged me out of anarchism and taken me into the post-anarchist period. Bert has made me aware about what is a human. And so to connect so much with that. And Brian has pushed me to say, no, this kind of research where you say, I cannot make recommendations and so on, and just to stay in that state is not acceptable. You have to make your research work. And they forced me to write papers that are practice-based. I was always writing just position papers, theory papers, and so on. So where am I now? Now I'm the director of teaching and learning. I've had to find leadership mentors. And do you know what? I found two, both alive, both very active. Every one of you have heard of them. The one is Zelensky and the other is Budanov. The two individuals who have perfect focus. They have a perfect purpose and perfect action to save their country, this community of care that they are engaging in to save their country, with purpose, focus, and response, I'm almost done, is what is guiding me. And as I was supposed to talk about the strategies that we are using at UKZN, I'm still thinking about it. And the more I speak with Michael, the more I realize I don't know whether we need one or not, but I think the Vice Chancellor and the DVC are on my case. So some of you will be getting letters to say you're part of the task team very soon, I hope. But that's my journey from anarchy to post-anarchy. And I think I'm going back there because I'm going back into the war zones. Thank you.
Okay, thank you for that, Naina. Some interesting points. Having mentors from different places, from beyond life itself, different environments. I think the role reversals are important, and also take note of the fact that as you move up into different positions, you will need different mentors. In the next two presenters, for me it's very, very special, and because they come from my discipline of public health medicine, and we've grown with each other over the last 9.5 years or so. The first is Prof. Kumbulani Shlongwane, who's going to speak on program perspectives and success stories in terms of mentorship at UKZN. He's an associate professor in the discipline of public health medicine. He has experience in teaching, supervising, and conducting research, particularly with focus on qualitative and mixed methods, having graduated more than 20 master's students and several PhD students since 2020. But he has more than 20 years of experience in research, working in HIV and AIDS research, cancer research, malaria, and health systems. And he has more than 80 publications. In 2022 at UKZN, he was one of the top 30 publishing research. He received the award for being in the top 30 publishing research award. He's very, very passionate about capacity building. And I have to admit, he's asked me 1 or 2 questions about our own DSI program as well in outside of this arena. And he's run several workshops around capacity building. And he's was co-founder together with Dr. Hlongwane of the Forum for Early and Mid-Career Academics at UKZN. So I'm going to hand over to him.
Thank you very much, Prof. Naidu. It's really a pleasure to be here, and good afternoon to everyone. So Prof. Samuels has already caused the damage. He has disrupted our conventions of mentorship, the way we understand it, and this hierarchical way. In fact, I think I'm just going to put a salt on the wound, because I think we've been very radical, and that's the experience I'm going to share about the mentorship, the disrupting the whole hierarchical system of mentorship. So I'm going to talk about the FEMA, Forum for Early and Mid-Career Academics, and how it started. Because we were junior, has just joined the academia, but we were second career academics because we had been working elsewhere. And then we soon realized that actually the support for early career academics was fragmented at the university. In certain schools, the support was better than in other schools. And there were some programs for those who were doing PhDs, like the Accelerated Academic Development Program, but there was no plan for post-credentialing. You finish your PhD and then you are on your own. And with all fairness, HR tried to intervene. They assigned us mentors, but that's where the problem started, because we didn't trust the motive. And it came more as a PM, a PM instrument, like a performance management. So we were quite radical about that. And then that's where we started the concept called peer mentorship. We said we're equally capable of taking care of our own developmental needs. And that agenda was really driven or was run by agency. And then the idea of early career academic platform emerged. In fact, it emerged from just corridor chats, where we're talking as colleagues about our own experiences and aspirations. And then it found way to our own College of Health Sciences. And then eventually we launched the program at the college level as EAP at a time. So we were clear, we set our own principles, our own purpose, and the real purpose was to create a platform of early career academics to build successful career and establish networks through peer mentorship. That was very clear. And then we even had our own founding statement with our own commitments. We committed to creating an environment that was empowering, that was conducive for success through peer mentorship. We committed to fostering a sense of community. We committed to taking responsibility for our own development and leaving no one behind. In fact, we drew from an African proverb that says, if you want to go quickly, go alone, and if you want to go far, go together. So we said, we are going to move as a collective. So that idea, we soon realized that actually we were focusing on early career academics and we're missing the middle. For some reasons, I mean, even the whole country in South Africa, at a higher level, they are talking about the missing middle, because even the funding system has been missing that group. So we realized that also in academia, there are people who are missing. So we transitioned to what we call EMAP, Early and Mid-Career Academic Platform. So as we were transitioning, we started really setting our own agenda and our own things that we wanted to achieve. And then we started organizing our own workshops and seminars to such that in 2019, exactly 18 January 2019, we held our first workshop. It was on compiling a teaching portfolio because that's an area we realized that whenever you wanted to be promoted, they would say, what's your teaching portfolio? And we thought among ourselves, we could share some experiences. So since then, we have conducted a number of workshops and seminars, including grantsmanship, social impact and community engagement, and so forth and so forth. I won't go through the entire list. One of the things we also did, we said, let's start an early bird proposal development workshops within our discipline and in our school. And that actually caused also some problems because there were other views that felt that if you had a PhD younger than 5 years, so we were not senior enough to run those programs. But we persisted, and as a result, that actually helped us to start getting that peer interaction among ourselves. It also assisted us to push our students to complete their proposal writing or protocols and to submit on time and then to start getting publications even from our students and graduating on time. So where are we now? So EMAP has evolved again. Nina, it has evolved again. It's now FEMA, as you heard early about the Forum for Early and Mid-Career Academics. It is now called a forum because forum is recognizable within the university structures. In fact, we have presented this concept. We've been consulting with various stakeholders on campus within the university, and we've been getting resounding support. So, because we were quite radical, and if you really listen to where I started, our mentorship was almost kind of like a horizontal because we're rejecting this vertical approach. But we have matured, and we now think we can embrace both vertical and the horizontal. I think we're just radical because we're, in a way, proving a point which we managed. In fact, we proved that you can bring radicalism into your own professional development, and it can work. So that was what we were doing. So right now, as I said, we have been presenting to various stakeholders. We receive big support. For example, the DVC of Teaching and Learning has actually pledged even impressive funding, plus started planting, and also even some technical support who have gone out for to do some strategic planning together. So it's really working quite well. Okay, thank you. So, okay. So the next step is now to meet with the Vice Chancellor, and I think there are plans now to finish that so that we can start submitting the documentation for approval through the university structures. But let me say this, even the workshops we used to have, we were funding them from our own pockets, like the refreshments, because we were saying, we want to do this. What am I saying here? I'm saying if you are so committed to your own professional development, it can be done. That's what we're trying to showcase, that this can be done. In fact, a lot of us now have been promoted to various levels. We even have a full professor from a cohort that started in 2018. And when we started, we had just graduated with PhDs. So what has been our key successes? As I said, we have had people also getting promoted. In fact, we have been occupying that space of being in the top 30 publishing. Our members, year in, year out, we have at least one of our members being part of that group. And then we have been sourcing grants, our groups, And then we even had a unit called Cancer and Infectious Disease Epidemiology Research Unit that came from that group. And then we've got a colleague who is now at University of Pretoria. We started a conference on reassured. There is a lot that has happened and that is still happening from that group. My last one, what have we learned? First, we have learned that mentorship is not an option, but a must. However, its design and implementation will determine whether it succeeds or fails. Whether you call it mentorship, because I heard Prof. Samuel's bringing other concepts, but what I'm saying is we all have a responsibility to work with others in their own professional development. So I think that would be all, and I want to thank all my colleagues that have been working, we've been working together to move this entity forward. Thank you very much.
Okay, thank you very much for that, Kumbulani. I think important points there. Peer mentorship, very, very valuable, often forgotten. And then also important to pay attention to the design of the mentorship program, because the design determines whether it succeeds or fails. But I want to be also a bit radical here and throw a cat amongst the pigeons and ask, is it because you matured and then were able to embrace vertical and horizontal? Or is it that you became so senior, you had to now recognize that you have to embrace vertical as well? Because in essence, you're there. No. I'm just throwing the cat amongst pigeons. So our last presenter is Dr. Shlongwane, who also is part of my discipline. She's a senior lecturer and is part also, she's actually co-chair of FEMA. She's previously served on several organizations, including PASA, which is the Public Health Association of South Africa. Her research focuses on human resources for health professionals, education, and social and public health aspects. And she has several collaborative projects focusing on postgraduate public health education and training. And she currently is part of our Senate membership and has received and is part of the Scholarship Award Committee and various other committees in the university. She's actually going to speak about her role in terms of moving from being a mentee to a mentor and talk about how you build effective partnerships.
Thank you, Prof. Naidu, and good afternoon to all the colleagues. It's a pleasure for me to be here to reflect on my journey from being a mentee to now still being a mentee, but now having a responsibility of mentoring others. Just to give a bit of a context, I came into the academy through an initiative that is driven mainly by, it was driven by the University of KwaZulu-Natal, but at a later stage, the higher education department also starting driving it, which is building the next generation of academics. So in instances, taking people who are interested in academia, who want to pursue a PhD. So that's how my journey with the academy started. So I have not been really had an opportunity to be in a structured mentorship relationship, but I've had an opportunity of being mentored by senior academics in both in my discipline in UKZN as well as public health professionals from across South Africa. And most of the relationships grew from like just informal interactions, and it sort of grew organically based on my developmental needs. So I've had a mixture of both vertical, which is the traditional mentorship that we know about, as well as the horizontal, which is peer mentorship. I've found both of them very beneficial and enriching to my growth as an academic, as a researcher, and a teacher as well. So what I've found with traditional mentorship, what we know as traditional or horizontal mentorship, is that it gave me an opportunity to learn more about, the requirements of the academy, what is expected in terms of the aspects, what I need, to become a good teacher, to start off my research. I got that from people who were supervising me, people who were seniors in my discipline. But I've also had an opportunity to be part of the peer mentorship initiative that Prof. Klongwane was talking about. And that allowed me the space to be vulnerable and self-reflective about my developmental needs. Because sometimes you find that in this, what we know as horizontal mentorship relationships, is that sometimes because you are paired with a senior person, or you are in an informal mentorship sort of relationship with a senior person, you're not sort of always guided. But when you're with your peers, you become more vulnerable, you are self-reflective in terms of your real needs. And because you are walking a journey and you've got similar experiences and challenges, you are able to really reflect deeply. And if you're really sincere about your development, you even hold each other accountable, which is what I've experienced with the peer mentorship forum. The peer mentorship forum has also given me an opportunity for reciprocal learning, because I learned from my peers, and I believe my peers also learned from me, and we continue to learn from each other. It also enhanced my collaborative and teamwork skills, which I think is very important for us in higher education, as well as in any space, to have those, to enhance those collaborative skills and to be able to work within teams. Because this also, in the context of the peer mentorship program, we're working with people from a number of disciplines, so you're able to even collaborate in terms of research, interdisciplinary collaboration in terms of research, which is what I think most of the universities are for grounding at the moment. So as I transitioned to become a mentor, my experiences have taught me that there's no one size fits all in mentorship, but we have to embrace the diverse models of mentorship that prioritize flexibility and create a space for emotional and social support. What my experiences have also taught me is that I need to give my mentees opportunities to tap into broader range of expertise and perspectives through networking. And I think networking was also highlighted in the previous session as one of the important things to begin to do as early as possible in your career, and not to be shy, to get out there and network with people that share similar expertise as you. It also allowed me to create an environment that foster inclusive and adaptable mentoring practices, because as Kumlane said, there was at a time where there was group mentorship that was through the peer mentorship. The peers came together and started supervising students together, doing proposal writing. So that became part of group mentorship, and it allows the mentees to learn from each other. And as supervisors also, we learn from one another. Also, I believe that we need to leverage the strengths of both horizontal and vertical mentorship to support the development of the next generation of academics or researchers in the African context, especially in our context. I'm not sure what's happening in other institutions in Africa, but for UKZN, there's a large cohort of emerging academics, so there's not enough mentors one-to-one. So we need to be flexible and adopt a diverse models in terms of group mentorship, peer mentorship, reverse mentorship. We need to be open, not just to the traditional ways of doing things. And also we are facing a situation where we talk about the aging professorate, where most of the seniors are getting out of the system and a lot of people that are coming in are emerging and young. So how do we harness that as well as what Kumblana was saying, some of them that are coming are second career academics, so they're not just coming with no skills. So we need to be open to see how can we tap in or leverage on all on all the different practices or different models of mentorship in order to grow the next academics. Thank you.
Okay, thank you very much for that, Dr. Hlongwane. Important points in terms of recognizing that different models of mentorship exist and that what works for one person may not work for another, but also the need for these different models of mentorship in Africa, and particularly where we have such a large cohort of growing and emerging academics coming through. So I'm looking at Lizzie. How much of time do I have? Only 5 minutes, but you cheated and gave the other group more, right? Okay, so I'm not gonna, there's a series of questions we set to ask our panelists, but I think what I'll do is open the floor and ask people from the floor if you have any questions for our panelists, or if you want to share anything before I ask my panelists to make concluding remarks. Maybe you can introduce yourself before you ask a question.
So, now I'm from Germany, and also I'm a big fan of Zizek. And just recently, I inspired by him, I tried to conduct some study about climate change exposure and the refugee camps around the world. And then my question is, how to use the help from the different mentors throughout life to construct yourself and find yourself in a growing up ways. Because you mentioned so many mentors, you know, in your great slides. Thank you.
So I think at different stages of my life, I was inspired differently. So it's not like I went looking for this particular mentor. I came across, I listened, I liked what they said, and then I started reading about, you know, their published works, finding more YouTubes and getting more ideas. And from there, I got the language of description and the concepts that made me understand in a deeper way the way society is constructed. Because no matter what work we're doing, ultimately it's about biodiversity, whether it's plants, animals, or humans. And at each stage of my life, it's sort of, I came across this and I just felt this was the way for me to learn. I didn't need somebody to hold my hand, but maybe it's because I come from a teaching background that I understand how to break it down into a way for me to kind of learn. Because the one thing I tried to resist throughout my life, and maybe it's because I'm an anarchist at heart, and a rebel with a cause, is that I never wanted to be dependent on anyone. And what I've heard today troubled me for a long time when I kept hearing people saying, you know, I need to be mentored for life. I need to be mentored even when I'm dead, and so on. It's like, at what stage do you take charge? Where do you get your agency in terms of taking charge of your life? Because if mentorship is for life, then what are you learning? You know, so I think the creation of dependency is a negative outcome of, and also cloning. If you only have one, you're going to clone yourself rather than become something new.
All four presentations were really excellent and provocative and very helpful. If I could just ask, perhaps following from this last comment from Professor Amin, and one point from Professor Kumbalani was you started with focusing on the horizontal and then you gave in and you said, well, both are important. The question really is that, in my sense, the right way to go to not concede to an or approach? Is there any downside by having both the agency and the openness to be continuously mentored? And to Professor Michael, to have both hierarchical and a focus on social justice instead of an or, it's an and. Is that really maximizing the benefit of both approaches rather than excluding one in favor of the other? Perhaps your reactions would be helpful.
Thank you for the question. In fact, in my concluding remarks, I was kind of addressing that because I said mentorship is a must, but I think what will determine whether it fails or succeeds is how we actually design it. I think our radicalism, because this has context, if the design from the word go, if we felt it was genuine and it was participatory, if we had been involved, but unfortunately at the time, it was perceived, firstly, we were matched, that matching, and I think it came early that this is where, this is a relationship. There are so many building blocks that must be present in the relationship. And if you are matching people, how do you know that they are a fit, for example, that they are compatible? The issue of compatibility came up. I think it was the motive. But later, because we had senior people who came to our sessions and really started opening up and showing that honesty, that we honestly appreciate what we have started and we want to journey with you. We have no expectations. And that's why we started realizing that actually this is correct. It's just that the way it was introduced was suspicious. I think if it's introduced correctly from the word go, there is a need for greater appreciation of both. Thank you.
In this South African context, we've started a new journal called Scholarship of Teaching and Learning in the South. And specifically, we make an argument about all relations embed power dynamics. And what we need to be looking at is how do we negotiate that relationship? I find that the North does not listen. What we have is they wish to talk. They do not wish to listen. And so the question that I think we are challenging, that hierarchical listening, is that you must listen to us, not listen to the South. And I think that is why we talk about relationality. We talk about ecologies of knowledge. Knowledges are always in competition with each other. But in most cases, the North is speaking and the South is listening. And I think that is a contestation about the democracy that Kumalani is talking about. If you start up with the key principle of democracy and social justice, and that all positions are contestable, then we are opening up this debate, as the Southern scholar De Santos talks about, an ecology of knowledges. I think in South Africa, we also got it wrong, especially in our decolonization debate, where we think about decolonization as a us versus them construction, rather than that we already embedded in each other, or we entangled in the way in which our relationships get co-constructed. But if we do not pay attention to power, we have a continuation of an injustice. And I think that's the agenda that the South African scholarship is very much strongly about. What are we meaning by taking the stance towards Southern scholarship? If it means challenging the hierarchy, then that will establish the openness that I think we should be going to. I believe that a lot of Africans are, and I work across many different African countries, they position and stage themselves complicit in the reception mode. rather than in the engagement and construction of new ways of thinking. So we heard the person sitting next to you, I've forgotten her name, do you know the culture of what it means to work in a hierarchical, patriarchal society? And what does that actually mean to be able to negotiate power in that dynamic? I think if we don't pay attention to them, to those kinds of contestations of cultural worldviews, where they come from, whose interests are being served, we become complicit in the marginalization. And I think what I'm hearing from this morning, there's not enough debate around that complicity, and it needs to be opened up.
Thank you very much. I think you raise a critical issue. And for us in the US, maybe because it's a different system, the need for mentorship is exactly to address that which you've put forward. How do you address the issue where there are few faculty of color, for example? You need mentorship because for you to get the big grants, you're not going to get it as a junior faculty member. So I do see the point in I don't think this is either or, but I think it's a strategy that we have used, I think as a faculty of color, to try and get up, to move up. I feel like we also rely on like collegial partnerships, right? Like other faculty at the same level. But I do think that depending on the system of the country that you're operating in, redressing some of those issues requires that you have mentors. Hopefully these are mentors that are aligned with the same interests. So that's what I wanted to clarify. It has to do with not just not being compliant, but getting mentorship in a way that optimizes what you're getting at as an individual.
If I may say, it's not just simply about the self ascending, it's about how you, as a representative of the marginalized community, allow yourself to be an agent of that broader systemic change that's needed. And that's the responsibility that I'm not hearing enough discourse. We're hearing about how do I get ahead, which is a selfish individualism that comes from the West. And I think that construction needs to be rethought in academia. Are we creating individuals who believe that their self-promotion is more important than the systemic injustice? And I think you're on the right button to be able to say, I grow by building everybody around me, not just I grow to be excluded from the place that I came from.
To offer a slightly different viewpoint and maybe to trouble the discourse that Michael has started. So, of course, the North has things to offer because they came up with the ideas. We never had them. Now that we've jumped on it, now we're saying it's a Northern thing and we need to fight it and so on and disrupt it and so on. So maybe we should ask ourselves, why are we not producing the original thinking? So data analytics, where did it start? We had opportunities to do it here, we didn't. But there is something on offer there. So I think we have to be really careful about this, this binary that we're setting up. Because it's also a very generalized way. The North is also occupied by people from the South. People from the North are also here. And so it's a much more complex situation. And I think just to get caught up in that language of, you know, complicity and all of that is to say, how can we work with what we have together? Because I think that the harmonious way, as an anarchist, for me to say that is really painful, but you know, in a harmonious way that we have to get to grips with this. But I think for me, the major problem for most parts of Africa is not about whether you're doing it for yourself or not. It's about power. So for example, the professors who have to be called professors. I mean, I insist when my students call me prof, I don't respond to them. They know they have to call me Naina, because that's disrupting the hierarchy in a different way. Hierarchically, in terms of my knowledge of the subject, I am superior at this stage of their development. They will surpass me at some stage. But I'm not a superior being because I'm a professor or a director. And I think we somehow conflate those two things about your position and your practice. And in Africa, the thing is, you have to respect my position first before you can speak. And I think we have disrupted it quite well in South Africa, but not in all spaces. So you know, it's a much more complex and difficult point. So my mentor,
Thank you very much for that. We have one question, and then after that, if any of the panel wants to make final closing remarks, you can have the space.
All right. I was going to say Prof. Nina, but because of what you said, I'll just say Nina so that we can go by that. All right. So as an anarchist, in quotes, I just want to know, how do you keep yourself going? Simply because there are times when you take that position, you become a target, and people want to sometimes go or do things against you. And this from myself, personal experience. When I was early career, and I spoke at a meeting that I disagreed on a particular topic because it was in my field, and other people were debating about it, but in the wrong way, and they were senior colleagues. So I just stood up and I was saying that, no, that wasn't really the whole idea. And I tried to explain my point, but it didn't sit well with one other senior colleague. So it got a little bit rough, but it went through my superior to try and then calm me down in a way that I don't speak up in such meetings anymore. So my question then is, how do you keep yourself going? Because at some point I had to be quiet because my boss had to tell me not to speak again. So then how do you keep yourself going in such situations? Thank you.
that I wouldn't advise everyone to do that unless you have the power of confidence and personality. But it's also about circumstances, right? I'm married to, I would say, a very powerful individual, not politically, financially, or anything. He's a very arrogant person, but he has the strongest self-concept of anyone I know. No one can touch me because he will intervene. So I have that protection. I also am not afraid to lose my job because I'm not the breadwinner in the family. So I have that confidence that I can say what I like and lose my job. It doesn't matter. So it depends on everyone's individual circumstances. And in a sense, you have to be a bit of a loner to survive by yourself. So I think it helps. I think it also helps that I was born so late. All my siblings were married and so on, to grow up with older people and fight my way, which was a good thing because my parents were so much older. And I was strong physically. You know, I would hit my father if he did anything, you know. Sure. I was that kind of a child. So yeah, it's circumstances. But I wouldn't advise you to follow my route. Not at all.
Okay, thanks. So if anybody wants to make any final comments from the panel? No. Yes, okay.
Are you guys
especially the UKZN, you are working on this mentorship from different angles. But how are you going to transfer this good idea to other universities? Let's tell you one of my academic experience in this country. I worked at about 3 universities. The moment you raise a point against officials, higher official, not against in purpose, but you are targeted. And wherever you go, especially in the institution, you have to, as you say, you have to look around. Whose idea I'm supporting and whose idea I'm opposing. You know, that mentality is everywhere. So how are you going to make a difference? UKZN, okay, you can communicate with internal communication media, but the issue is not about UKZN. It's about an age, especially the young academicians, the youth society. So how are you going to create a positive impact in the country or in the continent?
Okay, thanks. I'm going to let one person answer and then we have to end.
So I would just say your biggest insurance is expertise. You must really know your field. You argue from a point of theory, concept, methodology, not from personal opinion. That will take you nowhere. So it's not, I feel this way and so on. I mean, I have been speaking loosely here, but really when I get into an argument, I will pull out all the weapons of theory, methodology, and concept to tackle a position. So it's not about your perceptions, your beliefs, and so on. No, I don't think that will work. But
Okay.
I must tell
Okay,
you,
so-
I'm punished
Yeah.
as a director.
So Michael, Michael and then Kobelani.
Sorry, my chair is trying to pull us all to the end of the session. So when we first started out in 1980 to develop a doctoral program, it was the students who actually pushed us to design a new doctoral program on different values, different principles. We started with 13. Today, we run a doctoral program just in the School of Education alone at UKZN that ranges to about 300 doctorates, same number of staff, about 300 doctorates. But what we did was change the model of the design that Suloshni was talking about earlier, change the design features. Now we run programs, cohort programs, seminar-based programs nationally, inter-institutionally, in regional contexts, in different parts of Africa, in different specializations, different methodology. What's changed is the principles governing the design opened up a space for multiple forms of dialogue. And that's the network theory that I think we should be exploring, alternative forms of how we co-manage social justice.
Maybe from the perspective of FEMA, there has been different views as we are organizing ourselves to be recognized by the university structures, whether we go national or we go university-wide. But we said we can't start saying we want to plant it in other institutions until we consolidate it within our own institution. I'm just demonstrating that we have already had that call that these things are not only affecting a single institution. How do we reach out there? So we are keeping our eyes, even actually during COVID opened an opportunity that we're running our sessions online. And we were surprised that a lot of universities, we had people joining our sessions. And a lot of them are now already making a call to say, you know, we need something similar to yours. Can you help us, you know, establish something like that in our institution? So, but we are optimistic that with time, we will get there. Thank you.
Okay. Thank you very much for that. It leaves me to thank our panel for a sowing some seeds for quite deep conversations that will go forward. I think for sharing your ideas with the panel, with the participants who will probably, hopefully take back to their own organizations as well. I think some important points is one is recognizing the power dynamics in mentorship-mentee relationships, accepting that there are different models and there are different fits for different people. You can't actually use one model and apply it to everybody. And to end, Kumulani spoke about us walking together. What I would like to add is we always say it takes a village to raise a child. And so we the village, the child, and all of us. And so I think that's the way we move forward. Thank you. Happens now. Concluding remarks. Oh.
I had a very long conclusion, but I think after the events that have taken place, many of you must be just waiting to get rid of me from here so you can go and have some dinner. But I think for me and the impact of what has been presented today shows that when you collaborate and you have these programs, the success that it breeds. And so we start off with Wafi. You gave a very nice overview and you spoke about a whole lot of things, but I think in there, the food security and the climate change is very pertinent to our continent. In general, Africa gets neglected by many first world countries. So I think for me, there's something in there that really is for us to think about in future and to build on that. So thank you very much for that. And of course, Dr. Razak resonated very well with our emerging researchers because he gave a nuts and bolts sort of talk on the mentor and mentee relationship. And what struck me was that he comes from humble beginnings, and most of our African researchers and scholars come from the same humble beginnings as well. And I think that is of immense benefit. And of course, Till, in your session, the proof of the pudding is in the eating. So we saw the successes of what this program has bred. And thank you for that session that you did. It was very enlightening to hear the wonderful stories that were presented. And of course, we came to the last session. These are my UKZN colleagues. I know they're very passionate about things. But what struck me most and sort of I was almost horrified is when Naina said something about sex education. And I'm wondering, this is a mentor-mentee relationship and what she's going to talk about. And so I think, Naina, thank you for the humor and the things that you bring to this session. And I think finally, from UKZN, this has been an immense success. Thank you to our international colleagues for making the time to come and be with our colleagues from South Africa and the rest of Africa, and to our collaborators from our university, that you made this such a success. So I wish you a good evening and I wish you further success. Thank you.
Thank you so much. Thank you. Yeah.